3 counties, 24 cities, working together, accomplishing more than any of us could alone. Whether your roots run generations deep, or you recently moved to Greater Portland, you are a part of Metro, the nation's only regional government elected by the people. Planning for the future, preserving what we love. Let's keep our region thriving for decades to come.
I'm Laura Lepley, a Metro Park Ranger. Here at Oxbow Park, safety is our #1 priority, not only for our guests, but for our staff members. I'm at the Welcome Center and you're at the Regional Center. The council chambers are located on the 3rd floor. In the event of a fire or fire alarm, please exit through the door in the northeast corner of the room. Go down the stairway to the 2nd floor, exit through the main entrance by the reception desk, and gather in the courtyard outside that entrance. In the event of a medical or fire emergency, please call 911 and notify the security agent at the reception desk. The nearest defibrillator is mounted on the steps leading from the reception desk down to Grand Avenue. Thank you, and come visit us at Oxbow Park.
Is there a safety video? Great.
That was it. You're ready to go?
Oh, all right, great. All right, well, we have a quorum, and I'll call the meeting to order. I'll now ask our clerk, Ann Mazzini, to please call the roll for attendance.
Good morning. Councilor Lewis.
Present.
Councilor Simpson.
Present. Good morning.
Councilor Nolan.
Present.
Councilor Rosenthal.
Present.
Councilor Gonzalez.
Present.
And Deputy Council President Huang.
Present, thank you. Our first item today is Supportive Housing Services Healthcare Alignment. Metro's Supportive Housing Services staff will deliver a presentation on healthcare alignment with the SHS program, along with experts on the topic from HealthShare of Oregon. Aligning healthcare with supportive housing services is one of the 6 goals of the Tri-County planning bodies identified for improving our regional system. With us today are Liam Frost, our interim housing director, and Dr. Kat Livingston, medical director at HealthShare. Thank you for coming, and take it away.
Good morning, Deputy Councilor Wong, councilors. It's a pleasure to be here. Liam Frost, he, him, his pronouns, interim housing director here at Metro. To my left is Ruth Adkins, masquerading as Dr. Kat Livingston, who will be presenting here during the presentation. It's a real pleasure to be here today and not talk about SHS reforms. We've been in front of you a number of times over the last few months, but it's really a fantastic opportunity to share with you, I think, one of the greatest achievements that we've done collectively across the region at fulfilling expectations of voters, taxpayers, and most importantly, the people who are served by SHS. This particular subject is personal to me. 16, 18 years ago, I worked as a caseworker in the Tenderloin in San Francisco. I had a lot of clients who lacked health care, who were experiencing homelessness and housing instability, who a lot of folks, through their own initiative, were able to secure the health care that they needed. A lot of folks didn't, and ultimately did not succeed in housing. It might feel like a no-brainer to a lot of folks to connect these two systems. It isn't. These two systems speak different languages, they have different cultures, different histories, different sources of funding, and a lot of complexity. Until SHS locally, it was nigh on impossible to fund the membrane, the connections that were needed to connect the systems. Through Ruth's leadership here at the Metro Housing Department and our connection with our friends at HealthShare of Oregon, we've already made a lot of headway, but I don't mean to steal anybody's thunder, so I'm only here to introduce this item. As you can tell, I'm excited. I'm going to hand it over to Ruth to lead the presentation, but thank you all for this opportunity this morning. Thank you.
Thank you so much, Liam. Good morning, counselors. It's so great to be with you. For the record, my name is Ruth Adkins. I use she, her pronouns, and I'm on the regional policy team in the Metro Housing Department. We are so excited and grateful to be with you today with our partners from HealthShare to present about this topic area. So my role today is just really to provide a very brief introduction and level set for the work, and then you'll hear from the true experts in this space from HealthShare. Next slide, please. So just for folks following along at home, again, healthcare system alignment is one of 6 regional goals that were approved by the Tri-County Planning Body, or TCPB, within Metro's Supportive Housing Services Program, or SHS. The original goal language set by TCPB was, quote, greater alignment and long-term partnerships with healthcare systems that meaningfully benefit people experiencing homelessness and the systems that serve them. Developing this plan under the guidance of the TCPB was a deep partnership between Metro, HealthShare, and the county health and housing teams. And a shout out to our amazing partners, one of whom is in the room, I think others are watching today, who's been with us every step of the way in this collaboration. So why this goal? Well, as Liam said, we all know that housing and healthcare are interdependent. You cannot have one without the other. Health and housing integration efforts have been underway in lots of spaces with many partners for years and years. So what we're doing here is not trying to solve everything or be everything, but what we did at our regional planning table with the counties and HealthShare, and now with a broader array of partners, is really identify where are the areas, what are the key areas of focus and strategies where Metro, as the regional convener, can add the most value to accelerate work that's underway. This work is about trust, and building relationships. It's about changing policies and workflows and ways of thinking between 2 highly complex, highly stressed systems, and so we can better serve our shared patients and participants. Each project and pilot and table has lots of complex details and many moving parts, but it really boils down to this last bullet on this slide, cross-sector collaboration to improve housing and health outcomes. That's the bottom line in all of this work. Next slide, please. So you see here are the 3 areas of focus within the Regional Healthcare Alignment Plan. The first area, and I won't be going into detail for this brief intro, but just to say it's around hospital discharge options for patients experiencing homelessness. This includes, among other things, a pilot about to launch shortly, led by one of my colleagues on the team, focused on supporting patients with high acuity behavioral health needs as they're exiting inpatient psychiatric care. This strategy area is not quite as far along as the other 2, but you'll be hearing lots more as we move into launch and implementation in the coming months. Today, you're mainly going to hear from the HealthShare team about the other 2, the second and the third strategy areas, the cross-sector care coordination and data sharing. And through our partnership with HealthShare, they have been leading this regional coordination, again, in partnership with all 3 counties and an array of housing and health partners. Next slide. So this slide just sort of attempts to show like what I've been talking about in terms of the alignment between HealthShare, the counties, and Metro. There could be a lot more bubbles on this slide. We have some slides that have many, many bubbles. One of our SHS provider partners dubbed the health and housing work as the land of 10,000 tables. There is a lot going on in this space. The need is so great. But it's so complex, you have to chunk it out into smaller efforts. There can be no one grand table. But we are united in our shared objectives to improve health and housing outcomes, and we're doing our best to align and coordinate amongst those various tables, not only for our sort of regional areas of focus, but with various other partners doing other pieces of this work. And as you see on this slide, we have expanded beyond our original core planning team to include the healthcare plans, hospitals, Trillium, the other coordinated care organization for Medicaid in the Tri-County area, medical respite providers, and of course, our shelter and housing providers. So, Metro's role, as always, is as the convener, the coordinator, sometimes the cajoler or nudge, the cheerleader, and the funder. So let's go to the next slide. Just a quick recap of our investment to date. Through SHS, bless you, is a total of $2.8 million. So within that, $1.8 million was approved by the Tri-County Planning Body last April to come out of the Regional Investment Fund, or RIF, and that is supporting the amazing teams in each county that have health and housing integration as their focus through this current fiscal year. So they are doing a number of projects at the county level around health and housing integration, and also this gives them the capacity to be founding partners and ongoing partners in the regional work. So shout out to all of them. And then we also have invested a total of $1 million of Metro SHS admin dollars to launch the HealthShare team that's focused on housing, led by Adam Peterson, who you'll be hearing from today. We started with a seed investment right at the beginning of 2025 of $400,000 to get this team established, and the early impact and results were so promising and exciting that we invested another $600,000. And so this current funding will cover the work at HealthShare through the end of this calendar year. Next slide, please. So just to underscore a few takeaways that we want to leave you with today before we turn it over to HealthShare to share more about some of the strategies. What's the impact that we're having with this work so far? We have a long ways to go, but already we're building those pathways, those tables, those workflows so that housing and service providers can get the support they need to support SHS participants to the health care that they have before these pathways did not exist. So again, we have a long ways to go, but that's what we're building toward. We have an aligned and data-driven focus on our shared populations that have the highest acuity needs, and you'll hear more from Dr. Livingston about that in a moment. We're, of course, striving for greater efficiency, better use of our resources, and frankly, less stress and burnout on the part of staff in both sectors because they have this ability now that we have set the table and been working with partners to bring them together. Even at a time of extreme challenge, shall we say, we are innovating, we're working together differently, we're laying the groundwork through the partnerships and relationships and trust to weather together and better serve our most vulnerable neighbors. And again, that's what this is all about, focused on, amid all the complexities of the system change, what we are united in is focusing on the needs and the health and housing outcomes for our shared patients and participants. So that's all for me, just as kind of a level set. Really want you to hear from our HealthShare partners. Unless there's any burning clarifying questions about what I just shared.
Ruth, can you maybe explain or provide some examples of like how that partnership plays out kind of in the ground in the community? Is it like, folks that require these additional services that are in housing have access to on-site care? Just like, what is that?
I think HealthShare is going to be describing that, so maybe if we could just put a pin in that for the moment, and then we'll be circling back for sure for additional questions and discussion, because they are the ones who are really making it happen. We do have a special guest star today to bring up, and that is the CEO of HealthShare, Mindy Statlander, to just share a few remarks, and then we'll turn it over to Adam and Dr. Kat. Welcome, Mindy.
Hi. Thank you so much for having me. For the record, my name is Mindy Statlander. I use she, her pronouns. I serve as the CEO for HealthShare. And I'm just here for a minute today to say thank you for the opportunity of partnership, for your collaboration, for your support, and to express just how important this work is to HealthShare and our deep commitment to this work. HealthShare of Oregon, for those of you who don't know, we serve a little over 470,000 Medicaid members in the Tri-County area. So we serve the same jurisdiction that you all do. We're responsible for providing behavioral health, physical health, dental, and non-emergency medical transportation to those Medicaid folks. So we spend a lot of time thinking about how do we make sure that people have the best access to health care that they need, that meets their cultural needs, linguistic needs, that their complex physical or behavioral health needs. We are locally founded and governed by health plans, local health plans, health systems. The counties are part of our governing board, and local providers. I also have the pleasure of serving as a TCPB member, so just very much appreciate the amount of work and collaboration that group put in to the work that you're going to hear about today. We come to this partnership by way of trying to understand what was happening in our community for people experiencing significant mental health and behavioral health needs coming out of the pandemic. What we realized, contrary to part of the public narrative, was that it wasn't that there were more people experiencing conditions like opioid use disorder, stimulant use disorder, or psychosis, but that the complexity of those diseases was getting a lot worse, kind of when you looked pre and post-pandemic. So that was the thread that we started pulling back in 2021, 2022 to try to understand what was going on for our population. We've done a lot of work within the healthcare system. You'll hear a little bit about that in the presentation today, but we're doing our part to try to make sure that the services that we're providing within the healthcare delivery system are also meeting those folks' needs. When they show up in the ER, do they have access to medication-assisted treatment? When they show up in an inpatient medical setting, do they have access to an addiction consult service? How are we integrating mobile crisis teams on the ground to make sure that people get connected to care? But as part of that work, we also understand that we are inextricably linked to your outcomes too, to the housing system's outcomes. And so you'll hear about, we have for the first time a data-based understanding about that. I think Liam talked about how we all know intuitively that they are inextricably linked, but we understand that our outcomes and success are related to your outcomes and success. So our hope here is really that we can all win together, most importantly for the shared people that we're trying to serve, and to reduce some of the bureaucratic barriers, even though they're steep and challenging because we come from two wildly different sectors, to be able to serve the folks that we're both trying to serve better. And with that, I'll turn it over to the real experts, Dr. Kat Livingston and Adam Peterson.
Thank you, Mindy.
Thank you.
Welcome in, Dr. Livingston and Adam.
Good morning. I'm Kat Livingston. I'm the medical director of HealthShare. I'm also a practicing family physician, so I'll see patients on Thursday morning.
Good morning. For the record, my name is Adam Peterson. I use he, him pronouns, and my role at HealthShare is the portfolio manager of healthcare and homeless services integration.
And do we have the slides? Excellent. All right. So
there we are.
Yeah. We look pretty legit, I hope. All right, so if we can go to the next slide, please. So Mindy already gave you some background about HealthShare being the largest CCO in Oregon, so let's go ahead and skip to the next slide, please. All right, so the plan is first I'm going to give you a little bit of background about the work that we've done at HealthShare in the space in terms of our high acuity behavioral health cohort. We've got some fantastic data that's informing a lot of our aligned work. So back in 2021, Mindy had mentioned that we started really looking at this intersection of substance use disorder, the substance use disorder crisis, the housing crisis, and psychosis, and thought as a Medicaid payer, what is it that we could do to better understand more about this population, the size and scale of the population, how people are engaging with services or not engaging with services. And so we embarked on what we called the ecosystem analysis or high acuity behavioral health analysis. And that's been really powerful and guided a lot of the HealthShare's interventions and a portfolio of investments that I'll share with you momentarily. The other big thing that happened last year is that we entered into a data use agreement with Multnomah County, where for the first time we actually had HMIS data shared with us, and we have bidirectional sharing. And so we've really been able to start to dig into some of the combined data analysis between healthcare and housing. So this lets us know from the healthcare perspective how people are engaging with the housing system, and from the housing perspective how people are engaging with the healthcare system. We have asked around the country, who else is doing this work? And the answer is not many people are doing this. So we are definitely among the forefront in the nation, really starting to look at this intersection of housing and healthcare, which is very exciting. Next slide, please. So one of the things that we can really do as part of this bidirectional understanding is figure out how we can use strategic coordinated efforts, aligning housing resources and healthcare resources together to improve outcomes for both housing and health. Let's skip to the next slide, please. So here are some of the data that we have come up with in the past 5 years through our high acuity behavioral health analysis. So we defined, first we actually convened all of our behavioral health leaders and physical health leaders in the region and said, how is it that, what is the population that we really want to focus on? And through discussions and advice of that group, we landed on focusing on those who have stimulant use disorder, opioid use disorder, psychosis, and unintentional substance-associated overdose. So we essentially looked into our healthcare claims and identified all of the folks who have any of those diagnoses. And that accounts for 9% of HealthShare adult members, which is about 27,000 people. So when we look at those 9% of adult HealthShare members, they actually account for 29% of our total costs for HealthShare. So this is this is a population that uses a lot of resources. And one of the biggest areas that we see them using the most resources is in terms of medical inpatient admissions. So while they're only 9% of our adult HealthShare members, they're 39% of our adult inpatient medical admissions. So as a physician, what this says to me is that they are very sick, and there's a lot of opportunity, hopefully, to prevent them from getting sick enough to require inpatient admission. Next slide, please. So other data, and I won't share all the pie charts of these, but we see higher emergency department visits for this population, higher avoidable emergency department visits, the higher inpatient medical admission rates, higher avoidable costs kind of across the board. We've done some data analysis for mortality, which is quite striking, that this population has 4 times higher death rate. And when we look at 18 to 30-year-olds, the death rate among this population is 13 times higher. So just a profound opportunity here to really think about what is the preventable morbidity and mortality for this population. We did do an analysis of our own housing insecurity flag that we developed within HealthShare and found that across the board, any indicator of housing insecurity increases all of these risks by about 2-fold. So there's a lot of opportunity here, as Liam was talking about, just to really think about how is it by bringing together health and housing, we can really improve outcomes for this population. Next slide. So, as I mentioned, in 2025, we were able to partner with Multnomah County and integrate the HMIS data with this existing analysis that we'd already done. And here are some of the key takeaways that we learned from the Multnomah County HMIS data. So people in this cohort, so people with stimulant use disorder, opioid use disorder, or psychosis, made up almost half of the people who are actively homeless. They made up 1/3 of the people in rapid rehousing and more than 40% of people in coordinated entry. The people in this cohort are twice as likely to exit to homelessness when they're in permanent housing or rapid rehousing. One of the striking things is that stimulant use disorder is especially prevalent in this cohort. So we have really great treatments for opioid use disorder. There's a ton of work happening in this space. Stimulant use disorder has different treatments, and this is really an opportunity for us to lean in on this population and better serve their needs. And finally, those receiving emergency shelter or street outreach have 18 times higher rates of avoidable emergency department visits. So there's a lot of intersection with our populations, and now understanding through this Multnomah County HMIS data, just really seeing sort of the increasing risk of potentially avoidable utilization. Next slide, please. So HealthShare took the data analysis and what we had learned from that, and now about 1.5 years ago, invested in a series of programs across our region in order to better serve this population and hopefully prevent some of that morbidity and mortality. So the dark purple circles are the ones in the acute care setting. So starting at the top, medications for opioid use disorder in the emergency department. So this is somebody goes to the ER, they have opioid use disorder, they're not engaged with treatment. This is building electronic health record workflows so that an ED clinician is very comfortable prescribing buprenorphine. There's a peer in the emergency department who can meet up with that patient. Once that patient is discharged, they are supported with navigation to substance use disorder treatment. So that program is something we're expanding in 4 different EDs in the region. The next one is the addiction consult service in inpatient settings. So this is, I practice inpatient medicine for about a decade, and this was like life transforming for the teams to have a specialty addiction consult service, seeing the patients while they're in-house, being able to start them on medications for opioid use disorder, being able to effectively manage their pain, and then really helping them connect from hospital discharge to outpatient substance use disorder care. A substance use disorder peer is an essential part of that team and follows them into the outpatient setting. So we're expanding that into a new hospital. The other one is the acute care setting, the BOB program, which is in our Providence hospitals. So this is for high utilizers with mental health conditions, and these involve peers, mental health peers, to engage with folks to figure out what they need, meet them where they're at, and hopefully decrease their need to continue going to the ER. So those are the acute care interventions that HealthShare is funding. When we look at the lavender bubbles, those are community-based ones. So in our data analysis, we said, all right, so they're using the ER a lot, they're getting admitted at the hospital a lot, why? And the answer to the why question is because people are getting a lot of infections, so cellulitis, abscesses, sepsis. And so one of the things we noted is a dearth of wound care in the community. So we're funding the counties to provide wound care kits, tens of thousands of wound care kits across the county, increasing FTE in order to provide actual wound care. The next one is CHAT, Community Health Assess and Treat, which I think you all are quite familiar with. That's in partnership with Portland Fire and Rescue. So in, doing low acuity 911 calls, hopefully avoiding emergency department visits when they're not necessary, and providing follow-up care and connection to clinical services. The Project Nurture is a specialty focus area. I don't know if you all are familiar with it. Oh, okay, doesn't necessarily look like it, but Project Nurture is very near and dear to my clinical heart. So this is a national best practice integrated maternity and addiction care model that's really life-changing. It decreases kids' placement and foster care. It's pretty profound. And finally, our housing partnership with the Regional Integration Continuum. So this is the portfolio of investments that HealthShare brings to the table as part of our partnership with Metro. Next slide, please. So all of these data informs our clinical strategies, which I just spoke about. There's an opportunity for much better coordination of care, so the cross-sector case conferencing, which Adam will talk about. We can start to think about what are the clinical and coordination interventions that we could bring into housing settings, and something, post-acute care discharge coordination is an opportunity there. And finally, all of our partnership and strategic planning with Metro, the counties, in terms of how to really build better intersections between housing and healthcare to meet our aligned population's needs. Next slide. I'm going to hand it to Adam.
All right, well, yeah, thank you all. So to start, what I'd like to really highlight is the partnership between HealthShare and Metro and what that's looked like and what that's been able to bring to our healthcare work and the intersection between healthcare and housing. And first of all, I have a job, so thank you. But the partnership with Ruth and Liam has been able to provide staffing for a project manager, program manager, as well as data analysis. And this has really allowed us to take what HealthShare was doing in the health and housing space and then really expand it and grow it and take what was a really small program that started in Washington County of bringing healthcare and housing providers together to expand it across our region and grow it and then build it to the program we're going to talk about today, as well as then expanding that the ability to not just get the data from each of our counties, but figuring out what to do with that data and how it actually makes a difference in the lives of the people we're serving. And we're really excited about this partnership and really grateful to, again, Ruth and Liam and all of you for what we've been able to do, and also very excited for where we're going to go. And so I'm glad we get to talk to you today about what we hope you will see in the next year in 2026 as well. So next slide, please. As Ruth mentioned, the healthcare alignment goal was largely centered around three things, and that collaboration with Metro and county partners, and then establishing cross-sector care cross-system care coordination, and then the data infrastructure. The two that really were HealthShare led and driven were those establishing a regional system of care for care coordination, and we're really proud to be able to say that we have it'll never be completed, but we can put a check mark next to that, and that there are now formalized systems between healthcare and housing that weren't there when we started this. And same with the regional cross-system data sharing. Those are two things that we're able to say we are still learning and growing from them, but we can put a check next to that they're now happening, and we have the ability to use our data together to create better outcomes for our clients, our shared clientele. And then we're still working on the collaboration with Metro and county partners for those post-hospital discharge options. But being at the table and so bringing all of our different health system partners to the table is really adding to the conversation. And we're getting close to launching a pilot, thanks to the work that Kelly's doing as the project manager for Metro, and bringing creating better outcomes for people discharging from psychiatric hospitalization. So we're really proud of the work we've done in 2025 and excited for the opportunity that 2026 is bringing us. Next slide, please. So as I mentioned, one of the goals was to establish a regional system for cross-sector collaboration. We took what was a small program that began in the spring of Washington County, which was between Providence and Kaiser and a couple of their homeless services providers in Washington County, where they said, what if we had a space where the people who were in the housing system were able to say, this person has an unmet health care need, and brought health system folks to them and tried to figure out if there was a way to connect the two. And so what began is that idea of just creating a space where housing and health were able to connect and to create how do we do data sharing, or how do we do the ability for these systems to even be in the same room together when it comes to client privacy and when it comes to being able to share outcomes. How do we do that? And so they started that in Washington County, and it began in spring of 2023. From there, HealthShare recognized the value in this process and recognized what it was truly doing was bringing systems together. And so along with our county partners in Washington and Clackamas, we spread that practice to Clackamas County and expanded it and brought all of HealthShare's health systems to the table, as well as system partners representing behavioral health, representing aging and disability, and bringing in peer supports to this space that now is spread to Clackamas County, and it happens twice monthly, or I'll talk about what it physically looks like in a second. But then from there, took that great idea and expanded on it and built it into Multnomah County. And these now we're really, again, proud of the work that we've been able to do with our 3 county partners in building these spaces and these physical places where people with unmet healthcare needs who are engaging in homeless services are able to connect with healthcare care coordination teams to get these needs met. Next slide, please. So what does this actually look like? The physical thing of cross-sector case conferencing is twice monthly. Each of our counties hold a virtual space that's attended by our county health system experts and then local community partners in attendance. And each of these folks have gone through a rigorous process of bringing onboarding process and to ensure client privacy and security. And we have the local housing providers who are contracted with our county partners at the table, where they're identifying folks who are engaging in their services who have unmet healthcare needs. These could be physical health, these could be behavioral health, these could be dental health. These could be HealthShare members, they could be Trillium CCO members, they could not be insured, they could have Medicare only, it doesn't matter. We've created this space that is insurance neutral, where folks are able to say, we have a need for this person, and how do we get this need met? And our health system folks are there to do that in that space. And so what could usually take hours of calling around to different phone calls or different entities happens in a 15-minute time slot once every 2 weeks. And it's pretty incredible. And we at HealthShare have recognized that this again, recognize the value in what Washington County was doing, spread it to the other 2 counties, but also recognize that there's a place for a backbone organization to ensure sustainability, to ensure that there's data resource connected to this process, and to create best practices amongst our 3 programs. And so HealthShare has developed a community of practice that meets once monthly, and then as well as a steering committee for all of the places where HealthShare is showing up in this regional integration continuum, which again, Kat had mentioned, that's the name of what we call the place at HealthShare where the coordination with homeless services and healthcare is happening. And so we have we are not just looking at each program individually, but we're looking at it as a regional approach as well, and how we align practice from county to county to ensure good client outcomes across the board. Next slide, please. So far, we've now served over 400 folks that are in this cross-sector case conferencing. Ruth was one of the original folks who engaged in this process from the Kaiser lens when she was there, and I'm sure it's pretty cool for you to see it have grown from what it was to now serving over 400 folks in all 3 counties. And as I mentioned, we are serving anybody who comes to the table. No, there is no insurance requirement for this. It's also just improved the cross-sector knowledge of the people who are engaging in or who are working in homeless services. One of the coolest things for me that I've, since taking on this challenge of the role of the health and housing program manager, is really like learning housing. And I've learned so much in this process, and seeing how much it's a housing case manager can now navigate their folks without cross-sector case conferencing to where they need to go is kind of the truest form of this. Is now we're expanding beyond just a cross-sector space where people can get their needs met. We're expanding to a better system where people are able to get where they're able to, without this cross-sector case conferencing space, get their clients' needs met, which is really cool. We've also recognized that there is this gap in knowledge of even simple, what we as the healthcare system would consider simple, is a challenge for people. And so we've developed a Medicaid 101 for housing providers, which has been delivered to more than 350 homeless services providers about how to navigate this system, because it's not always easy. And what we have seen is that this work is making a difference, and that our initial data includes a substantial decrease in emergency department utilization, which I'll show you a little bit more on that in a second too. Next slide, please. Which is this slide. What you can see is that that dotted line up on that graph is our average utilization of folks on the high acuity behavioral health cohort for the emergency department. What you can see in the blue line is folks 90 days prior to a case conference and how often they're using the emergency department. And then what you see in the red line is folks who 90 days after their case conference, how much they're utilizing the emergency department. This data is very preliminary, and we are still learning a lot about what this process really means and what the causality means. And we assume there will be some amount of return to normal utilization, but we can see that in that time, 90 days prior to or post case conference, that people are not engaging in the emergency department as much, and we think that's a huge win. And now the next part is, what do we do with that, and how do we continue to learn from that data, and how do we engage folks in that at that time? Next slide, please. And I wanted to give you an example of just somebody who has experienced cross-sector case conferencing, in that we had a 56-year-old African-American woman present to the Multnomah County cross-sector case conferencing project. And this person is a member of all 4 behavioral health cohorts, or high acuity behavioral health cohorts. And in that space, the need was presented that this person was not able to really connect with a behavioral health provider, and what they were looking for was culturally responsive care. In that session, we were able to connect, one of our panelists is a culturally responsive care coordination program from Multnomah County, and we were able to assign that person in that session. And from there, that person was able to then navigate to an outpatient program designed for high acuity folks engaging in outpatient care. And through that, this was a person who was on the brink of no longer being able to stay at her permanent supported housing placement. She's been able to maintain since the case conference based on the new resource that was provided to her in that space, and the continued engagement from this individual with that person. So one of 400 examples that we could give you of a connection that are being made in cross-sector case conferencing. Next slide, please. So then talking about the data, and this is one of the things that Dr. Livingston talked about, that nationally we are one of very few regions that now has the ability to take homeless management information system data and combine it with health system data. And it wouldn't have been possible without our partners at Multnomah County also seeing the value and the vision in this, and how those two combined things can create better outcomes for our folks. And so through that work that we've been able to do with Multnomah County, we were able to then do an initial analysis and then show our partners in Clackamas and Washington County, look, this is something that's pretty substantial and is showing some really strong connections between our systems. We should do this in all three of our counties. And in that work, we were able to get Washington and Clackamas County to also look, we are on the very brink of signing that data sharing agreement with both of those counties to be able to do this work regionally. And in doing that, we also recognize that it is a big responsibility to have that much information. And so we've established a data governance process of all three counties and health system representatives to be able to say, what are the things that are actually going to move our system forward? How do we do this in the most responsible way? And how do we do this with the client in heart? And what are and really what are these things that we need to know that are going to help our systems make decisions about what might be valued and how we can look at adding to healthcare systems, looking at the right level of intervention for housing systems, what could make somebody successful at a housing intervention, and what would they need to do that? And these are the questions we are going to be able to start to ask now that we have that regional data, which is, again, very, very exciting, and it's pretty novel nationally to be able to have that ability, and we're very excited for the opportunity and the responsibility to do that. Next slide, please. So I've already mentioned a lot of what we've done. Now we're really excited to talk about where we're going with this. And that's really taking that data and establishing integrated data sets. And making them standardized, getting things done at getting data analyzed at a cadence where it can be actionable. Not just knowing what we know about us, like about the system, but how do we know what we need to do with that data, and who are these folks that we need to engage with, and how do we know to engage with them? And being able to start to use the data in that way is really exciting. We are also looking at cross-sector case conferencing and creating standardized metric set for that, and as well as an equity analysis of that, to be able to say, are the right people, or are people getting to cross-sector case conferencing equitably, and is it a process that anybody is able to access? And so we want to be able to, now that we know we've got something really great, we want to make sure that it's getting to all the people who could need it, and that's why we're doing the equity analysis. We also know, we're excited to be able to look at adding an additional team member to our team at HealthShare, so we'll be adding a third person, which is great, because there's a lot to do. We have our hospital to housing pilot that I'd mentioned, which is looking at discharges from psychiatric units to a coordinated system of behavioral health, as well as shelter case management, and then navigation to longer term housing, all done in a coordinated fashion. Looking at what we've learned from cross-sector case conferencing, we know it's great, and we know 400 people have experienced it. We also know there's a lot more people out there that need something like that and need to have information that we can share with homeless services providers. And so we're looking at a pilot on how do we share information quicker and easier and get them into the hands of people when they're earlier in the engagement with our housing case management. And that's what we're looking at with our office hours pilot. And then really looking at the other Metro goal too of medical respite. How do we create sustainability and systems change on our medical respite? And then the one that's, again, kind of near to both Kat and my's heart is the analysis of youth in HMIS. And when people are under the age of 21, how are they engaging with homeless services? And is there a place where healthcare can intervene at an earlier level that can create a change in somebody's trajectory in an early stage of homelessness? So we've got a lot to do in the next year, and it's I feel grateful and a real sense of really proud of the work we've done, really grateful for the opportunity to do it, and really, again, thankful for our partners at Metro and our health system partners and our county partners that allow us to do this work, because we couldn't do it without the partnerships that we have developed over the last couple of years.
Thank you so much. So on the next slide, we have kind of our question for you. And Liam, I don't know if you want to have any closing comments or anything before
No
we
closing
open it
comments,
up?
but just to remind council that we have both Mindy Statlander still in the room and Ryan Dybert from Multnomah County, should we need to ask those folks any questions as well. But thank you for the presentation today.
Thank you so much. So we have here kind of a question from us is really, what you would like us as staff to consider as we transition to, in addition to hearing, learning more about this work underway, but specifically as we're transitioning to that new Regional Policy and Oversight Committee, what would you like us to consider so that we can be successful in implementing and continue to make progress towards these goals? And of course, questions, discussion. Again, thank you so much for the opportunity to be here today. And I'm a little hard of hearing, so I will ask folks to speak up a little bit.
Great. Well, thank you so much for coming and presenting and all the amazing work that's gone into it. We'll start with Councilor Lewis.
Sure, thank you so much, Deputy President. I first want to start with a big round of thanks. In particular, Ruth, you're the right person for this job in a very unique way. And I think your efforts here are obviously supported by many people, but the opportunity for this to be the one out of the 6 recommendations that we're actually nailing feels really good. So Tri-County Planning Body has been a success, particularly on this plank. And we've moved the ball forward on the other 5 as well, but this is the one that I feel like, yes, we did it. And just wanted to give big shout outs both to Mindy, but also to Jeremiah Rigsby, 2 people who it's not in their job description to show up to Metro meetings, who have put in the time and put in the work to, there we go, no echo, to make sure that we are really integrated from the advisory board as well as from the leadership roles. Coming to this presentation today, I was not expecting to see that roadmap for 2026. I think it's really good that it's fleshed out. It's not quite a work plan, but we know where we're going in a way that feels very good and achievable, despite the fact that Medicaid funding is an absolute free fall. Like, I was kind of worried that we were all just gonna look at each other and say, okay, we're white knuckling this year, it'll get better someday. But the work that you're gonna be able to do, particularly with your data work and your data sets, makes me feel confident that we are moving the system forward. I wanted to focus in particularly on chat. I think that is a very valuable tool. I thank you for funding it. I hope that we can do 2 things. One, chat is a smaller district than our whole Metro district. So I'd love to replicate chat outside of City of Portland. And I also think that it's important to resource chat so that once you have folks who have gotten their care coordination and developed relationship through chat, that those are the people who can get them into coordinated entry or who can actually have the resources. Because I was lucky enough to go on a ride along and actually interact with some of those folks. They are feeling very stifled because they're coming from the city perspective and not the county perspective, to have all of the introductions. And sometimes it's just literally the things they don't have to give to people. So those two things, I think, will take Chat from being a really good city of Portland to a really good regional investment, and I hope we can keep it up. As again, it's a big bang for the buck with, I think, only 2 rigs out there. You're getting a lot of coverage in a day. In terms of what I hope to see as we move to the new Coordinated Oversight Committee, to answer your question, I hope that we continue to see healthcare show up. There is one of the spaces called out in chartering the committee, but show up not only, as you've done with a person and time, but show up with data and a creative mindset. The opportunity to continue to figure out how to meet people where they're at. Obviously, you've put a lot of thought into meeting people as they're exiting the hospital, but how to meet people on site. I love this incorporation of an insurance-neutral space. And at the end of the day, we need more spaces like that because the confusion between our safety net clinics and, provider pay, it's really hard to sort out even for somebody with a policy mindset. And just making sure that people know that if they need help, this is the door you knock on. So doing more to find that insurance-neutral space without further complicating or further stigmatizing the work. Thank you.
Thanks so much, Councilor Lewis. If I could just add, the partnership and the willingness to engage and kind of go through the kind of the messiness of figuring out how to work together. Not only HealthShare and of course the 3 counties, but also the hospitals and the health plans and the providers. When we've convened the folks working at some of the 10,000 tables, the spirit and the excitement has just been palpable and just really wonderful to see because we are really, folks are showing up. And even when we don't have easy solutions or there's challenges, people keep coming to the table. And so we haven't gotten there yet, but the momentum is really great. I just want to give appreciation to all of the community partners in healthcare who are showing up and housing.
Councilor Gonzalez, did you have a?
Yeah, I did have
okay.
my hand up. Thank you. Thanks, Deputy President Wong. Just opening with some tremendous gratitude for this work. It's almost shocking, surprising that other parts of the country aren't prioritizing what feels like so obvious, right? But I feel this gratitude that we've been able to leverage our resources, our assets, our systems in the Portland metro area to make headway. So I want to thank you for your work as practitioners and as doctors. A quick set of foundational questions for me. Dr. Livingston, during your presentation, you talked about the high acuity behavioral health cohort. About half of those people are considered actively homeless. I think that's how I understood it. So I was doing the math, 9%, 27,000 people. So about half of that. So one of the hard things about making policy in the homelessness system is that sometimes there are a lot of definitions about what it means to be actively homeless. So I just wanted to kind of ground that with how is the HealthShare team defining that versus SHS? Is it the same? How did we get there? And it's, again, very foundational question, not meant to be a gotcha. I'm just trying to understand a little bit more.
Yes, as part of this brand new relationship, we have learned that there is so much to learn about each other's systems. And so actively homeless is something that we need our housing partners to tell us what the definitions are.
Okay.
So that is defined by housing partners.
Okay, perfect.
And then the current HMIS data that we've been working with is only Multnomah County. So we don't actually know the proportion of those who are actively homeless across the whole region yet, but we will momentarily, probably in about 2 months, once we're able to finalize having Washington and Clackamas HMIS data as well.
Okay, that was my next question, so thank you. So it's only Multnomah County data. Liam or Ruth, is there anything you can share in terms of, so is it the Multnomah County definition of actively homeless? It includes chronic homelessness, episodic, how is that being defined? Just so I understand that 14,000 number, generally speaking, for Mulco.
I think our standard definition is anyone living in a place that's not meant for human habitation and or shelter, or transitional housing and/or staying on somebody's couch or in a car. Well, a car's not meant for human habitation, but yeah.
Okay, thank you. And just a follow-up question on that, because I think this is the beautiful thing about what happens when we're able to pool data together and connect dots. We're able to make much more targeted, calibrated decisions around investments to help people. Like that's a great thing. Do we have a sense what that might mean for like population A, population B? Again, another category of definitions that we have in terms of the high acuity behavioral health cohort. Do we have any sense on that for the data right now? Like what that percentage might look
All those folks that are
like?
experiencing homelessness and a disability, any of those folks in that cohort are experiencing a disability.
Are considered a population A?
Yes.
Okay, thank you.
And could I just add too, I mean, that's part, Adam mentioned the data governance group, because this is an agreement and partnership between HealthShare and each of the 3 counties. We just, was it yesterday? We just had HealthShare kicked off a new data stewardship group, so precisely so you can work through with the county partners, the experts in homeless management, information system data. What are those definitions? And to make sure that the counties and HealthShare are on the same page about, so there's lots more to come in terms of what do the data mean, what can we learn from it. So we're at the early stages of that, and it's really a hand-in-hand partnership. And not to be confused with Metro's data sharing agreements. This is specifically between HealthShare and each of the counties. So Metro is delighted to fund it and cheerlead it, and really, so we'll be able to have more information to come in future months.
Great use of regional investment. Can I like test a narrative that I think I heard in 2020, like when we were getting off with this work, and I want to see if like that narrative is still true, and or if data is proving that maybe that wasn't true, or there's like emerging discoveries that we're making. But I feel like when we were initially entering this work, or I guess I could say I was initially entering this work, because I know folks have been doing the work for a long time, there was this kind of, people wanted to like disassociate the homeless people were not like folks with high acuity behavioral health conditions. Like there was like, oh, those things are not, like don't call folks that are homeless, you know, people that have these disorders and things like that, right? So there was, at least on the ground level, I heard that. Maybe if you don't agree with me, please say that. But I just remember it being one of the popular narratives, especially with talking with folks and voters and in some of the service provider groups that were lobbying for the measure at that time as well. Do we feel like the data is showing that there's a different correlation or relationship there now emerging? How do we feel about that? And maybe, I don't know if you feel like you can answer that, or staff, just
I'd like to jump in, and then I'll hand it over to the experts, just because, you know, in a former life, I worked with Elizabeth over there at the very beginning of all of this, and I certainly was not reluctant in saying that a lot of folks who are experiencing homelessness are experiencing the trauma of homelessness, and also experiencing sometimes behavioral health issues, whether it's addiction or mental health challenges.
Okay.
I never had any reluctance about sharing that. I just wanted to be very precise about there are different folks that experience homelessness differently.
Yes,
and so while this is a huge chunk of our homeless population, we also have a number of different folks with different kinds of homelessness. But going back to our experts in the room here, my understanding, Councillor, is that due to the introduction of fentanyl and the introduction of new meth, it has exacerbated those maladies. I don't want to say tenfold because we're talking to experts right now, but quite significantly. Over to you.
Yeah, and so, I mean, homelessness is obviously really complicated.
Yeah.
What these data tell us, though, is it gives us a better understanding of how much, you know, if half of the people who are actively homeless have some of these conditions, that gives us a huge opportunity to say, all right, how can we work with shelters to, you know, make sure that they have linkages and access to opioid treatment programs? If they have stimulant use disorder, can we get them connected to treatment for that? So I think we just have epidemiology now that really explains what is the prevalence of those conditions, what are our opportunities, how do they differ between different housing programs, and so where can we do in-reach and coordination and like bring clinical services into housing programs so that people can be more successful.
Oh, that's incredible. Wow. My next question was trying to think about like working backwards from, always try and think about it through the lens of a constituent that comes and talks to me and is very concerned about, this is what I see happening and things like that. So when I think about we're walking somewhere in the region, doesn't necessarily have to be downtown, but we see someone experiencing about psychosis or clearly unwell and things like that. I think I'm trying to figure out how this roadmap, Dr. Peterson, of what you're working on will help us see those tangible improvements to once people enter care, they'll be more likely to stay in care and things like that. And so I'm also trying to figure out with what confidence can we as policymakers say, this is what's happening. When you see someone experiencing this, these are the steps that will happen in this system that we're improving and refining. I think perhaps part of your presentation was saying that there was a high level of unsuccessful exits because these coordinate integrations were not happening. So yeah, how do we kind of make that case into in a maybe 8th grade, 9th grade level, right, to folks, so that we can help them understand these kind of system level improvements, because I think people are losing trust that we can do and actually serve people that are experiencing these really high acuity cases. So I'm trying to land there somewhere. So this is an open question again to the panel.
My initial response is that we're still very early in this intersection between health and housing and the connections and relationships and building formalized connections between them. And so for someone who's experiencing active psychosis that is visible on and living on the streets, we are still figuring out how do we integrate the street outreach teams from the city, from the county into this work. And we've created some pathways to cross-sector case conferencing, but we know that there needs to be more. And so I think I don't have a great answer for you on how, what would I tell a voter? I would, outside of the fact that we are now we have developed relationships and connections and are starting to really build those real, I would call it connective tissues between the systems, and that's what's encouraging to me, is that they now exist, whereas 2 years ago, I think you could point at some things that were happening between the two systems, but now the formalized connections are much, much stronger. And thinking about 2 years from now, where it could be, is where I think then you'll have the right answer to tell the voters, but we're not quite there yet.
Okay.
And Councillor, if I may add to that too, if I could break it down and be real reductive, what we're investing in here is a structure and a connection, a system of connection. It will all depend upon the capacity of both systems to serve the number of people who need those services. And as we're all aware right now, especially in Multnomah County and the city of Portland, there are budget holes appearing, largely due to federal disinvestment, but also due to lower revenues than expected. And so we're seeing great results. Can we pump that up at scale? Well, that depends on the capacity of the systems to support the framework.
Mm-hmm.
And I would just like to add too that we also have decades of underfunding of the behavioral health system. We have no access to the state psychiatric hospital. And so all of this amazing work is in the context of, we have a situation where we have had people with acute psychosis who have not been able to access the highest levels of care that are needed in our state. So we are doing extraordinary work within our region, but it's within this larger context of a behavioral health capacity crisis.
No, I love that. I think one of the topics that this council has really been thinking about is we're doing all this work to really change and revamp the system, but there are key gaps that we need our partners to fill. So how do we talk to our partners at the state and be like, this is what we really need from you, and do it, right? Just one last question. I thank you, Deputy President Wong, and I've taken quite a bit of time here. Is the current White House has signaled this desire to change a lot of our kind of homelessness funding to a recovery model. I haven't done a lot of reading into what that actually means, but I would be curious on a policy level or an approach or a human impact level, I should say, kind of what do you see as some of those changes? We talked about disinvestment, changing investment going into the future, and if that is going to happen, how do we find a way to pivot to the programs that we can. Does this fit into that? I don't know. Like, let's talk about that, just because I'm trying to think about what are like linings of hope that we can continue to lean into, maximize our local dollars, and deliver outcomes, right? So, thank you.
I just wanted, I'm sorry, I just couldn't help myself, but come up
Welcome
to
back.
respond to your question. Sorry, Mindy Statlander, for the record. I just wanted to just thank you for that question about how our bureaucracies work better together to serve the people that we're trying to serve. The more elected bodies like you all that can be asking that of our systems, even if we might not have perfect answers the first go round, to say that it's important to integrate to serve our constituents in a way that matters and has duplicative impact, that matters. And I just wanted to say thank you for asking that question.
Hell yeah.
I can take a first run at the HR1 question if you guys want. I think it's going to be really that pivot that you talked about, even though we have a sort of stay from that for this year, all expectations are that that comes back next year, which, you know, means big changes in the way that permanent supportive housing is funded. We do know that we need more transitional recovery housing and recovery housing to help our behavioral health and mental health system work better. So while the priority around those types of housing is welcome, the trade-off is extremely challenging, perhaps not welcome. I think the more that we can get clear about what we want to protect and preserve together so that our systems with different budgets are not inadvertently undermining each other, and that we're really transparent and as clear as we can about, you know, many of the providers that serve the folks that we're talking about rely on blended and integrated funding across multiple jurisdictions. That's Medicaid, that's Metro, that is each of the counties. And so the more we can be precise about what we want to protect as we go through this, the better luck we're going to have.
Amazing. Great. All right. Thank you so much for the time. Appreciate it.
Councilor Rosenthal.
Thank you, Deputy Chair. First, I have to say thank you for the presentation. This addresses a need that I think, at least I felt we needed several years ago, but of course the system that we were developing here with SHS and housing was not fully ripe, you might say. And you've introduced me to a whole bunch of acronyms that I was not previously familiar with. So I'm going to have to go home and study my homework and you know, what's OUD and HABH. Some of these are things that I hadn't used before, because this is the first I've heard of HealthShare. So I have about three, well, I could have a lot of questions, but I'll just ask three. First of all, I'm a little curious as to why Washington County was the first to start coordinating, and they're the last to sign a data agreement. That's sort of an interesting, just an aside. I'm curious as to, you've served 400, and what do you think of the service population actually is? I mean, you're just getting started in this process. And the third one has to do with the youth cohort, which has very different kind of demographics. First of all, you can't put them into permanent housing because they probably can't live with it. They have probably different ways of going into the ER. And then, actually, another question, OHSU was developing a dashboard to try and put people going out of ER with certain kinds of, with your HABH, your high acuity behavioral health system issues, to try and coordinate them with housing and other services. And I'm just wondering if you've absorbed that database, that dashboard into what you're doing.
I'll start first with the question about Washington County, which is a good one. Why were they the first ones on board with cross-sector case conferencing and then have yet to sign a data sharing agreement? The folks at Washington County were part of a pilot program nationwide through a partnership with Community Solutions, which is an organization, a national organization focused on ending homelessness. And so Washington County was one of, I think, 7 pilot sites in our nation. And they signed data sharing agreements with the health systems individually. So with originally with Providence and Kaiser, they had data use agreements with just to be able to do that work individually. So they had what they needed to get that job done of the beginning of the coordination. And then now that HealthShare has brought in all of our different health systems and created, Washington County's original way of doing it was to do the data sharing agreements with Care Oregon, with with OHSU and with Providence and Kaiser individually. And then now that we've brought all the different health systems on board is when we're doing the big picture data sharing agreement. So it's kind of a technical answer, but it's why it's taken a while to get us there.
Okay. Do you want me to talk about the 400?
Sure,
Yeah.
go ahead.
I mean, I think, thanks so much for these questions, Counselor. So we know, and as Adam mentioned, like 400 is not nearly meeting the need yet. We're building the system as we go. But what was really important is to have it be driven by the participants themselves as well as the SHS providers. So in other words, having healthcare come to the homeless system to be able to, when a person who is in the SHS system, and it could be folks who are on the street, in a shelter, or even have been housed, but they still can't figure out how to connect to the healthcare system, nor do the SHS providers have that means. So that's really kind of the core. So it can be, because it's driven by the participant need or the housing case manager's request, it's really all over the map, right? It's some highly acute folks, but it's also some basic things. I remember in the pilot in Washington County early on, the example I always give was there was an individual in a shelter who needed their meds and couldn't afford them, and the shelter case manager came to the case conference saying, what do we do? How do we pay for this? And the healthcare folks were like, oh my gosh, this is a basic benefit in Oregon Health Plan and Medicaid. And they, got the meds delivered to the shelter, and they said, oh, and by the way, their primary care physician hasn't seen them, doesn't know where they are, but now we can connect them. So that's just one example. It's really a continuum across the whole spectrum of need, and that includes our elders, right? As we know, so many elders are experiencing homelessness. That's an important piece of the solution as well. So just wanted to kind of put that in there. I don't know if you would add anything about that, Adam.
No, one of the stats that we didn't talk about today was looking at Multnomah County's data. There are 27,000 high acuity behavioral health folks in all of HealthShare's network, and we know about 9,000 of them are in the HMIS system in Multnomah County. So that's about a third of all of our high acuity behavioral health cohort exists within the HMIS system, and that's just Multnomah County. And so when we start getting the data from our other two counties, we know that need will be huge. I don't know how big we could do cross-sector case conferencing, but we know that it's bigger than, the need is bigger than what we're able to do right now, but we don't know quite how to expand it because it's a highly human-intensive process as well of getting all those people into the room and all the right folks there, and giving the participants whose needs are being expressed enough time and respect to get those done in a person-centered way. It takes time, and so the expansion and the scaling will happen, and we're still figuring out exactly how we're going to do that.
And then the youth?
The youth, yeah.
Oh, so to your question, we're going to be looking at all youth who are in the HMIS system. So young, adolescents who are independent, the whole range. So our plan is to understand more about where they are, what their health indicators are. If we have certain clinics that have much higher proportions of homeless youth, are there opportunities that we could do sort of clinical and housing partnerships for where people are actually getting care? So that's a new area, and then we'd really be partnering with the housing folks to understand what are the services that are available that are not necessarily being accessed, and how we can link up both clinical and housing services for youth. So that's brand new work. We're still waiting to get the full HMIS data from Washington and Clackamas, but that's a plan for 2026.
Thank you.
And then the last question, I think, was about OHSU, and yes, they are absolutely partners at the table, and so we're figuring out how to build on their amazing, I don't know if you've seen their Mission Control Center where they track. So we are figuring out how we can sort of leverage that existing resource and what is the right path for their members and their patients, but they're definitely at the table for the work.
Great, thank you.
Along with the other hospitals.
Great. Councilor Lewis.
Sure, thank you. Adam, as you look at all your case conferencing, what kind of units do you need? I know we've talked a lot about the services for the people. What is if you had a magic wand, what is the kind of unit prototype that you would put out there?
Great question. It would be expanded capacity in intensive behavioral health outpatient, and as well as access to the state hospital for our highly acute folks who currently don't have it. And that there's, what we kind of see is that folks who should be in the state hospital aren't there, and then therefore they're somewhere else. And that level of service is needed to serve is higher than the capacity that we have. And so if we could expand the two capacities, I think we'd have a lot better opportunity to serve those folks. And so that would be my initial recommendations. I'd love to hear Kat's thoughts too.
Right, it seems like there's a lot of opportunity within permanent housing to really figure out how is it that we can bring in substance use disorder services, psychiatric and counseling services, peer services to really stabilize those people who are in permanent housing and keep them housed. And then there's also, it seems like there's a lot of opportunity as people are entering into the housing, like through coordinated entry, making sure that they're already connected in with the kind of services that are going to help them be successful in housing. And then that will also improve their healthcare utilization as well.
Yeah, and thank you so much for this question, Counselor, because we know it's still going to be a huge challenge and bottleneck. So for example, if folks, even if we're able to better coordinate and exit from the hospital into a medical respite or recuperative care program, which of course we have a long-standing flagship here in Multnomah County, but Washington County has a newer program and Clackamas is about to launch one. So part of our regional work is how can we coordinate those efforts? But no matter how good a job those programs do stabilizing a person after they exit the hospital, we don't have places for them to go, right? Whether it's even a shelter, we don't have enough housing units, we all know that. So part of the value here, though, is being able to have that relationship and that coordination to support the individual and ensure that they have access to the ongoing health care that they need, because too often that's been one of where things have fallen apart for folks. And again, we're trying to work with the counties to meet, their folks and their providers where they're serving people in different parts of the continuum. So it's not even so much what type of housing as are we ensuring that that collaboration and those pathways are there so that folks can get the ongoing, whatever the healthcare need, from eyeglasses all the way up to high, intensive behavioral health supports. So we haven't fixed it by any means, but it's building that muscle again of being able to, and the sort of legal permission structure, if you will, to be able to talk to each other, as I look at Carrie.
Great, well, I just want to thank you for your partnership. And maybe just one closing question for me is, as we begin the work of our, Housing Coordination Policy Committee, flipping the question, what advice do you have for us as we begin to think about setting that agenda? And, I think a number of counselors here will be on the committee. So what should we focus on, and, how can we continue to build that partnership through that committee?
So it would be fantastic if we could just really continue to align our efforts where we have these populations of focus and really making sure that we're leveraging healthcare and housing resources in an aligned way, especially as we're looking to budget cuts kind of across the board. So just really making sure that we're continuing to sort of share priorities and figure out synergistically how we can improve outcomes.
And I would say, I know there's intention to have healthcare represented at that table, to create a real partnership, to have one healthcare person represents one healthcare voice, and to have multiple stakeholders potentially from healthcare, including the provider side as well as the payer side, could be really, you'd get a different story from different level or different types of healthcare providers. And I think including those voices, either formally or informally on that council, could be a really strong sign of partnership in developing a real true continuum of both housing and health outcomes.
Great. Okay. Well, thank you for your partnership again, and thanks for coming in. I learned a lot.
Thank you all very much.
Thank you so much.
Thank you so much.
All right, we're going to move on to our next topic, the Economic Development Council Work Group update. We're going to hear on an update from the council-led Economic Development Work Group. The presentation will be a joint effort between counselors and our Deputy Director of Planning, Development, and Research. So we have Molly Wilkinson and Tom Reinhardt coming up of Tom Reinhardt Strategies. So to begin, I'll turn it over to the work group's chair, Councilor Simpson. Thank you for convening this and putting so much work in. Take it away.
Absolutely. Thank you, Deputy Council President Wong. Thank you to the members of the public that are here in front of us. And good morning, colleagues and staff, and to everyone else tuning in to today's work session. I'm very pleased to be here today to both update everyone on the recommendations from the Economic Development Work Group and also take questions and feedback from my fellow council members. I think this is something that we really wanted to see out of our council moving forward in terms of how we do these work sessions and possibly having counselors lead. So I'm grateful for that feedback, and I'm happy to start us here. So a year ago, I asked Metro Council President Peterson if we could form a work group to investigate how we as an agency can do more focused work to build our economy, particularly for people in districts like mine who need jobs and opportunities and income growth the most. I'm grateful to President Peterson that she not only directed the formation of the group, but also asked Councilors Lewis and Gonzalez to join me, which I both thank you both for your time and dedication to not only this process, but everything that we put into this. So thank you. It has been a pleasure working with them on this initiative. The community I represent has long needed a more aggressive approach to economic development, and they've been asking for it for a very long time. Our businesses and families do not have access to the capital and opportunities that other parts of the metro area or region have. Now that large parts of the region are facing difficult economic times, we took the opportunity to have different conversations in this work group than we usually do about Metro's role in strengthening our economy. I'm excited to be here with you, all of you today, to update you on this work of the group and look forward to your input and recommendations we came up with together. Next slide. Before we jump into the recommendations, Tom is going to give us some background information about the economic development in the region, and then Councilor Lewis will talk a little bit about the work that Metro already plays in that space. To level set quickly, I want to make sure that we're all on the same page with the definition of economic development. The work group has been working off of the assumption that economic development means strategies and programs that both create new jobs and retain and expand existing businesses. The jobs we are attracting are high quality, meaning that they create family wage incomes and that the growth that comes from these jobs benefits all people. Next slide.
So our work group charge was to identify the gaps and opportunities for new economic development actions and policies. And the three of us invested a lot of time into this work, engaging over the past year, not only with each other, but also with staff across the agency. So it's my role today to walk you through our deliberate process to help you understand how we fulfilled this charge. Next slide, please. Yeah, so our first step was to ground ourselves in the current economic conditions of our region and what role Metro has historically played in shaping the economy. As we all know, since the pandemic, our region has recovered more slowly than others. Our peers and population growth and job creation has not rebounded to what it was before 2020. We see that across a number of metrics. And through this agency's leadership and coordinating transportation investments, urban planning, our visitor venues, land use, we have a critical impact in the regional economy. But our central mission has not been to lead on things like financial incentives for job creation. We work first in this work group to understand the various roles Metro plays, and importantly, what is not our role in this important work. The second phase of our work entailed exploring what peer regions do to support and expand their economies. This part of the process was eye-opening for us, as it revealed that we are significantly behind our peer regions in several key aspects of the economic development world, like tax policy, business incentives, and land readiness. And I will say in some ways that meant that we had to examine not only where our region is, but where our state, through our state's economic development agency is. Lastly, in our process, we spent a few meetings reviewing potential actions Metro could take to support economic development, and crucially, how this would work in coordination with partners in both the public and private sectors, who we did engage. So to sum up, I want to relay that we have been thoughtful and thorough, and like Councilor Simpson, I look forward to input today. We will now turn it over to Tom, who was our consultant who supported the work group. Tom Reinhardt, take it away.
Thanks, Councilor Lewis. And for the record, Tom Reinhardt, Reinhardt Strategies. I'm excited to be here today, not just to do this work session with the council, but this is my first Metro work session I've ever participated in, which is great fun. So thanks for inviting me.
Well,
thank you. My role today in this first section is to kind of build on what Councilor Simpson and Councilor Lewis said around what assumptions, mindset, foundation that the work group laid that will help you understand why the recommendations are what they are. So the first slide, and thanks to your colleagues at the port who provided this slide, and one colleague is here today, so thanks to the port. This is just, we don't want you to read all this, but we want you to understand, building on what Councilor Lewis said, we were very thoughtful about, there's lots of local government entities and quasi-government entities and partners in this space who are nonprofits. Metro has a role to play, but as you see, Metro just has one part of this, so it's going to take quite a lot of coordination. We're going to talk about that in the recommendations when Catherine gets there. We were very intentional about it, so we wanted you to understand that as we learned this together, we also tried to get a firm grip on what other partners are doing. So thanks to the port for that. Next slide, please. Many of you here have seen multiple presentations, so we didn't want to get in deep around how the narrative has changed significantly in the past few years, but we did want to do just a quick overview. So my family moved here in 2002, so we were in the middle of that first bullet point there, that era from 1990 to 2020, when lots of people, particularly Gen X folks, were moving here. There was pretty insignificant job creation. As everybody knows, particularly policymakers and elected officials, from 2020 till today, that has been much different. There have been recent competing data sets around population growth. I'm not going to get into which might be right. We don't need to debate that. We just you need to know that our assumption was that has been slower, and we are facing slower growth. We have a troubling trend of job losses, 10 straight quarters in Multnomah County, but you'll see in a subsequent slide, we also have worrisome indications in other counties. You know better than most the multiple crises facing large employers, and of course, reputational challenges. So that's what we thought about and underpinned our conversations in the work group. Next slide, please. Again, similar that we just wanted people to understand that we did not shy away from the reality that Oregon historically, and the metro region in particular, has not been in this position that be completely disconnected from the national economy. Right now, we face that challenge. We are not in the same spot that most metro regions are. Next slide, please. And I thought from my own experience in Oregon, both in the public sector and the private sector, this data was some of the most compelling for me, and that Washington County has historically been the key driver to growth in the region. This is new territory for us, and not territory that we want to remain in. And as you can see on the right, population growth and not just natural change, more deaths and births, but also net migration. You've probably seen this in many presentations, but we want to make sure you understood the work group, looked at this, and made sure it informed the recommendations. Next slide, please. All right, you'll see this reflected in a couple different ways in the recommendations at the end of the presentation, so I wanted just to touch on it. In looking at our peer regions around the country, it became more and more clear in conversations and meetings, and a couple of us took advantage of the trip that many of us did to Minneapolis to meet with peers there as well. There's a much different approach to governance and coordination historically. I use the greater Minneapolis and St. Paul partnership here as one example, in that they have combined their organizations that do incentives with their organizations that do marketing. So if you think about it here, that would be a combination and a much more formal structure around Greater Portland Inc. and the incentive entities in our region. We don't have that. We have lots of different groups that have to work hard to work closely together. That's another challenge we have. So we wanted you to understand that as we got into what we think needs to happen in the region, particularly Metro's role, this was a key driver, and that it's hard for us to coordinate, and Metro needs to see itself as a convener of some of these key conversations. Next slide, please. We don't want to leave you with the impression that we didn't talk about our strengths. We have many strengths. As you know well, we have access to nature and strong cultural assets and strong neighborhoods and an urban fabric that has been built through billions of dollars of transportation infrastructure investments and urban planning that makes this place special. I also want to highlight the workforce strengths that we have. We have some folks from our community here that run excellent world-class training programs. We also have a very high degree of college graduates, 43% in the region, college grads. We also have nation's leading computer engineering talent. 14% of the U.S.'s talent is in this area, and you can guess why with our large employers on the west side. And of course, being 1% of the population, having 14% of that type of talent is an advantage for the future economy. So we wanted the council to understand we did take those into account too. We have some things that we can build on in this region. Next slide. Oh, I think I passed it over to Councilor Lewis.
I think it's back to me.
Yes.
Yes, I get the really great slide that nobody's going to be able to read because we did a whiteboard exercise and we were charged to come up with the full list of Metro's background and roles that support and undergird economic development. And as you can see, there's a lot. And over in the upper right-hand corner, you'll see narrative change, because there are some things that we do because they're part of our DNA. They've been longtime responsibilities at Metro, but we have never put them in the economic development frame, which means we may do them in a very particular and arcane way that maybe sometimes doesn't always fit the business community's needs. But if we do a better job of holding hands, we can keep doing what we're doing, but the entry point or the product can just shift so that we're actually meeting the community expectations in this frame. So we really want to thank staff for some of this work that they did brainstorming with us. Next slide. So economic development is woven throughout our programs. Obviously, the catalytic regional transportation investments are opening up opportunities. I can't be representing District 2 without saying that the work that is being done at Sunrise will open up an entire economic development plan that's been in the works for 20 plus years. Actually longer than that. I think I was in elementary school, so let's say 30 years. And it's thousands of acres, and it's the opportunity to see a different part of the region step forward with economic development investments. But, you know, every one of us in our district can think of opportunities that only are unlocked when a parcel gets good transportation infrastructure. Visitor venues, including the zoo. Again, the zoo is the highest ticketed place in this entire state. And that means we are drawing people from across the world, across the country, and across the state here to visit, whether they're visiting for a day or a week. We know that that leads to folks coming, hopefully staying downtown and taking the max, not parking in that parking lot, but spending their money downtown. Housing and transit-oriented development investments, in particular, stepping forward recently with our housing bond, but TOD really looking at how we've been able to take a program that initially was not focused on equitable outcomes and make sure that we are doing the work on the housing front across this region in transportation corridors. And then we also have our grant programs, 2040 grants, large-scale community visions, and our regional transportation options. So we do have some economic development lenses and those muscles we just need to strengthen. I will say in talking to site selectors as part of this process, these are not the things that hit. There are site selectors who are very interested in the kinds of workforce we have, and obviously the kind of workforce we have means that we have enough housing for them, et cetera. But the things on the previous slide that Tom went over, you know, our tax structure, and yes, two of them did mention that you have no sales tax. And that means something, particularly for folks who do supply chain machining. It really drives us batty because we can't raise it a cent to pay for transit. But on the flip side, that is something that they note. So we need to do a better job of making sure that we connect some of these pieces to what the site selectors are looking at, what they do have on their shopping list, if you will. And with that, I turn it over to Councilor Gonzalez.
Oh, hell yeah. Okay, excellent. This wasn't the slide that I was preparing to talk about, but I'll talk about it. So, in terms of the founding values of us in this work is really to meet the moment and support the growth of the economy. We've heard the reports, we've read the headlines, the mandate almost that we have now to help Oregon and the Portland metro area pivot into the work that is essential for our region and for the families that live here. We're acknowledging that there is much slower growth that is happening and potentially leaking as well to other places. People vote with their feet and businesses vote with their feet. So we need to really reevaluate Metro's kind of fundamental relationship with that. One of the things that I've shared at our table and that I share with our partners outside is that, Metro has this history, this charge to manage growth. But what do you do when there's no growth to manage? And that is the shift that we now need to embrace. So I don't want to ignore the incredible work that we have in the history of planning and the conditions that's created for us to thrive in the past. But in a lot of ways, the playbook that we've used is not quite positioned to help us for this next decade and the decade thereafter. So we're very much using this as our charge for the recommendations that we bring forward. Next. Great. And I think I'm passing this off here.
You're passing it
All
over
right.
to me. Thank you very much.
Thank you, Catherine. I looked at the slides and I thought this was the 13.
You're good.
My bad.
You teed up what we're going to talk about on this slide perfectly, so thank you.
Can I say one more thing, Catherine,
Of
as well?
course.
Before I'm sorry to cut you off. So the work that Catherine's going to talk about is going to be the new recommendations, the things that we can do above and beyond what we have done. I want to really acknowledge and recognize too, Tom alluded to our partner Westside Economic Alliance, Elizabeth Mazzaro Myers, who is here in the audience with us, who's been doing kind of a parallel process with us around understanding how Metro can improve our current systems around urban growth report and our modeling and forecast, which I think is a really important kind of parallel thing as well. So I want to acknowledge that she's in the room and the work that our partners in the region are doing to help us kind of open our approach a little bit more. Anyway, thank you for letting me say that.
Thanks very much, Counselor. I appreciate the introduction and the tee up from you, and I want to thank all three of you who participated in the work group over the last 10 months. I think it was a real learning process for all of us, and happy to share with the rest of the council and those of you watching in the audience the recommendations from this group. If you all remember, this group was charged with making recommendations that the entire council will discuss today and vote to approve via resolution in February. So specifically, I guess I should introduce myself. I'm Catherine Charlo. I'm the Director of the Planning, Development, and Research Department here at Metro, and we, along with a couple of other departments, have supported the council in this work. You've heard a lot about urgency from the three councilors who've spoken. There's also been deliberateness. Over the last 10 months, this council work group has thought carefully about roles and gaps and what Metro's lane is, and really determined we don't want to duplicate efforts. We do want to build on our current capacities and roles and expertise, And we want to make sure we're doing what only Metro can do. And we've heard that a lot from our partners as well. Metro, please don't try to step into our work. So what we have laid out for you here with these recommendations fits into 3 primary lanes that the group established or determined really make sense for Metro's work. And those are as a land use and policy entity, as a convener, and as a funder. So the recommendations you see on this slide don't, as Councilor Gonzalez, encompass everything Metro does. It doesn't encompass what we do now, have done in the past, or frankly, will do in the future. What it does set out is a few key steps that are achievable in the short term to set the stage for more intentional activity in the economic development space moving forward. And they honestly help us build muscle for future work. So as I mentioned, you will discuss these today. You will vote on a resolution in February, and that resolution would direct staff to further develop these concepts, bring back work plans, budgets, and timelines for them. So I'll walk through them quickly. The first is creating a job-ready lands program. The second is launching a housing production acceleration fund. The third is focusing our update of the region's comprehensive economic development strategy, or CEDS, to create a real strategy for target industries. And the fourth is to integrate strategic economic development activities into our daily planning and decision-making as an agency. So we're going to talk more about each of these. I'm going to turn the next slide over to Tom to talk about the Job Ready Lands program.
Thanks, Catherine. So building on another comment that Councilor Lewis made in her remarks, I want to talk about the role that site selectors and the way that expansion of businesses and retention of businesses happens with land. So the way that works is there are these people that are hired by companies, large, medium, and small, to look for types of land around the country. These groups, these site selectors have built a national database in which they aggregate all different types of land and what jurisdictions are looking for in terms of their business and economic expansion. We are not a player in that space right now. The people that we talk to around the country that do this type of work said we are not a region that has a sophisticated approach to this yet, and that we are not very well coordinated. So one of our recommendations here is that this is an opportunity for us to address this gap. And the way we would do it is actually to create a program that worked with local jurisdictions to identify, as a part of the comprehensive economic development strategy, what do we want here in this region in terms of business expansion? What types of land parcels do we have? What is their current status? So we would fund some technical expertise with a private sector partner that would do that analysis. And then we would figure out, with targeted parcels of land, how do we move them up the chain of readiness? That would require investment. But this is what our peer regions do, folks, in Denver/Douglas County, Minneapolis, Salt Lake, Nashville, Detroit. All these folks have programs in which they actually know the status of the land and what they need to do to move them up, what the site selectors have, which is, bronze, silver, gold, platinum. There are levels of readiness. And the whole reason they do this, and for folks who are listening or in the room who have owned a business, you'll get this. This is to de-risk a decision for a business. Businesses won't move and expand in our region if they don't know how long it's going to take them to upgrade a parcel or to build on a parcel. If they don't know if it's 5 years, 6 months, 7 years, 2 years, we're off the list. We want to be on these lists. So I'm trying to be very deliberate about how that works, just so you know this is the seriousness with which we tried to approach this recommendation. We do believe this is a gap. We believe it fits very firmly within Metro's real expertise in land use and planning, right? And frankly, the way folks in the region think about Metro's role, right? You do an industrial land inventory. We need to take the next step to try to figure out how do we move towards readiness. So that's the short overview of that. We're happy, again, in the question and answer to take questions on that.
That's great. Thank you, Tom. Next step, I'd like to just broaden out some of the steps toward getting to that site selection database. As we've fielded this idea with partners and gotten some sort of Shark Tank-like questions from our executive leadership, it's become clear that while Tom laid out an excellent case for why we want to participate in this type of site selection database, there are steps between here and there to make sure that we're ready to do that. So very high level, we just sketched out some of these steps. Some of this will change, but it gives you a sense of the type of work that really fits into Metro's convening lane. And frankly, that first item into our land use policy lane. So we're looking at, between now and this fall, looking at the buildable employment lands inventory that our land use team created as part of the urban growth boundary expansion question a year or so ago, and make sure that is as up to date as possible and incorporates some of the feedback that we've heard from partners who had questions about certain elements there. So we will refresh that, share it, get input on it, and simultaneously continue working, and I'll talk about the specifics of this a little bit more, but to create with our partners a regional strategy for target industries. Because without that regional strategy, it's going to be very hard for us to determine what types of sites are we actually selecting, what do we need and what do we have, and how do those match up. So we are looking late this year, early next year to start that site solicitation and need assessment process. Were we to have either our own questions or proposals for the state legislature around job-ready lands, that would be the time for you all to start thinking about them. There may also be other broader proposals that come to this body, and that would be a time to see how they fit well with this. And then 2027 and beyond, continuing to identify funding, both for participation in the database, which Tom described, but also, frankly, if we're going to move parcels through the process of sort of ranking in the database, we will need capital investment. And that capital investment is going to need to be a collaborative effort that reaches well beyond Metro. Metro's resources aren't going to be adequate to support that type of investment. With that, again, like the other items that we're describing, staff will continue to work closely with partners and with you all to refine this work program and to bring back, after the resolution in February, a more fleshed out plan for that. Next slide, please.
Real quick,
yes,
just ask, when you're talking about site readiness in the rankings, is that really based on regulatory constraints that we have locally, or like zoning, permitting, or is it also like mainly on just, is there infrastructure? Like, I'm trying to understand, like, are they just looking for like something that's ready to build on?
Yeah, Councilor, so the spectrum would be from, type 1, type 2 environmental remediation, all the way through full utility installation, permits pulled. So there's various levels there, but just trying to give you a short answer, and I can give you the detail offline, but there's all these different pieces that they look for that help them with timeline and capital investment to understand what's already been done.
And you're saying we don't have that inventory now?
We have some of it. What we have is, from talking to people locally and nationally, we have some parcels that have pieces of it. We have some that have dated information. We just don't have a way for, if someone is actually really looking at this region for a relocation or an expansion, to really get up-to-date apples to apples comparisons with what they would see from other regions. That's what this would help us do.
Thank you.
While we're asking questions, you talk about target industries. That seems to me to be
Could we go back one slide, please? Sorry, Councilor. Go ahead.
Critical conversation to have at the council level. Have you envisioned how that conversation happens and what criteria go into that? Because a job is not just a job, just a job. We want to be deliberate about the kinds of jobs that we are investing money to encourage creation of here?
Thank you for that question, Counselor. And in fact, what I'd like to do is skip 2 slides forward and talk about the SEDS, and then we can go back to the Housing Production Acceleration Fund. But I think this is more responsive to the question you're asking. So one of the things, as we look at that Job Ready Lands program writ somewhat larger, one of the things we keep coming back to is exactly the question you're asking, which is what types of jobs and for whom? And we have some answers for that as a region. We I think all read them in the paper, the importance of, for example, semiconductor manufacturing jobs. Those are critically important, but there is also clearly an unexplored conversation that needs to happen amongst regional partners about what other types of businesses and industries and activities are we, which could mean, say, accelerators or training facilities or programs. Which of these are we well suited to actually attract? And that
Yes,
conversation.
And what differentiates
Yes.
us from any
Yes.
other Joe or Joanne metro area?
Yes.
Used to be resource-based, and we had timber, and we had fisheries, and we had hydroelectric that allowed us to have Alcoa manufacturing aluminum here based on local resources. World's a little different now. But if we're just going after exactly what every other metro area is going after, it's not very impressive.
Really appreciate that. And this slide attempts to capture that. There is an existing process, an existing product, which is the Comprehensive Economic Development Strategy, or SEDS, which is led by Greater Portland, Inc., and which Metro has participated in past years as well. It is a federally designated list, essentially, and in order for a project or an incentive or an initiative to receive federal funding, it needs to be on that list. What has become critically clear over the course of our conversation about job-ready lands and about economic development generally is that the role that strategy plays needs to be increasingly strategic. It can't just be a long list, because if it's a long list, the types of selection decisions and prioritization decisions that we would need to make to participate in the database that Tom is describing, we wouldn't have the guidance we need. It is really the creation of those target industries that are really matched well to who we are as a region. And so this graphic starts to get to that. Again, I think what we are trying to do here is present you with some pretty high-level ideas that you all like, that you give direction for us to flesh out and bring back. But as we look at this, the colors of the boxes, the box itself is intended to represent this version of the Comprehensive Economic Development Strategy. And that top piece is really what you're talking about. And it is drawn from local economic opportunity analysis. It's drawn from SEDS priorities. We're obviously going to need a lot of coordination with a number of the other bodies that are thinking about economic development in our region, including some state-level economic bodies, including our partners like the Port, like West Side Economic Alliance, like partners on the East Side. We've already gotten a lot of interest and desire to be involved from a number of our cities around the region that have really strong opinions and ideas about what these target industries should look like. And so we sort of marked there in italics that first piece is an elected official leadership group. It's not written in there, but obviously that effort needs to come back to this council. There's no question about it.
As we look at that,
at multiple points.
I would put out some expectations that I hope we all bring to this. And they start with, we don't want to race to the bottom. We do not want to chase after industries whose primary location decision-making points are low taxes, limited regulations, low to no organized labor representation. We don't want to chase after right-to-work status. We don't want to chase after unhealthy conditions on the jobs. We want to chase after industries that have high density per acre of jobs that would be new to the region on the land that's involved. I didn't see any organized labor representation on your stakeholders group, and I think that's a major omission. I saw one group, and I might not have got them all because it was a dense slide, Tom. I saw one workforce-oriented organization. Our higher education programs, especially our community colleges, ought to be on there, and we ought to have organized labor as partners in this effort. We also ought to have as partners in this effort organizations with a history of using our land use system not as a punishment but as an inducement. And the success we've had over 40 plus years because of the predictability, as you were both talking about. Businesses don't want to start or move here if they don't know how long it'll take them to turn around permits and things like that. That is a lot of what our land use system offered. And we should not ignore that. We should not ignore the lessons that we've learned from that as we look to the future. Things are different and things will not be the same as they were in the 80s, but we shortchange ourselves if we ignore the lessons from all of that, including perhaps within this room.
Thank you.
Thank you for that, Councilor Nolan. I do want to start by saying that everything you touched on is the intent, right? When we think about the race to the bottom and modeling what our peer regions are doing, we're actually trying to figure out what is the Oregon way? What is the way within our values to do this? Right across from us is local representation from our carpenters union here in the region. We invited them to be guests to listen into this conversation. So,
welcome.
Absolutely. Everything you just stated is also in the works. This is just very high level. They didn't write it.
I want to see it in the documents. I want to see it in the resolution.
Absolutely.
I want to see it in what we tell our partners.
Absolutely.
So that it can't be just, oh, well, we'll slip it in the way we want it no matter what. I appreciate your particular leadership on visions and values.
Absolutely.
But let's be proud about them.
Yeah.
Put them out there for the public to look at.
Absolutely. Thank you for that feedback. We'll make sure to incorporate that into the resolution. Again, we are setting our values as a body, but also as a region. And the things that we want to see for the upliftment are exactly the things that you touched on. And we'll make sure that they are reflected.
I'm delighted to hear that.
Of course.
Thank you, Councilor and Councilor. I think that fleshed out better even than any presentation from me could have the critical connection between this strategy around industries. What are our target industries and the Job Ready Lands program? That said, I do want to just take us back to that convening role that Metro has and look at these italic lines at the bottom of each of the boxes. We are still thinking through what would a work plan to get us through the steps we need to do to create a strategy of target industries, to determine what lands are available, not just that Metro knows about, but that cities know about, that might be available to support these types of targeted industries. And then what are the gaps? And then the question is ripe for how do we identify places to fill those gaps and what is needed to make them ready. So still quite a bit of convening work there because that's not something Metro can do in a vacuum. So, yes, thank you.
I want to add a little bit of color to that, just based on having sat and talked with several site selectors. I want to illustrate exactly what we mean there. Because we're talking about industries, and industry identification is important, but we should also be looking at the ecosystem surrounding our employers. And it's not just about duplicating within an industry, but making sure that that industry has the ecosystem it needs. So one site selector said, look, the political leadership that met the moment was a chair who actually said to their largest employer, who do you need to relocate here? Who do you need closer by? And they literally said, we need somebody who makes this exact part for our supply chain. It would be great if they were in our metro area. So we were not getting that shipped in, and logistics would mess up our entire system. And so then they had a very clear plan that was find somebody who makes this part. And that was part of their economic development strategy. It was not just doubling down on more of this, but it was making a healthy ecosystem. And that is something that takes political leadership and really meets the moment in a way that we haven't done as Oregon, we haven't done in this region, and that the site selectors are asking for. And it would be very easy for us to fill that gap. So just to add, when you say a hole, that is my description of some of the holes.
That's great. Thank you so much. So now if we could go back one slide. Thank you for your agility here. You all have seen this. I don't think I need to go into it in detail, but one of the things that has become clear in our conversation over the past 10 months about economic development is that housing is a critical piece of what we need to attract businesses and to retain businesses. And thank you for all of your support for the Housing Production Acceleration Fund, which you approved earlier this month, or yeah, I guess it was this month. As you know, that came out of the Regional Housing Coordination Study that you approved in the fall. We're excited about this opportunity. It gives us a chance to leverage some of the balance we have in our construction excise tax reserves to try to move more quickly, move some housing development along the spectrum of the activities that need to take place. So the things there are things you've all seen, talking about supporting pre-development, talking about brownfields grants, looking at technical assistance funding that would help actually move permits from one stage to get projects approved and out the door. And then there is the possibility of looking at some land bank strategies, doing some high-level early exploration of land bank strategy, where the public would own land and hold it for development and contribute to making more affordable development in that way. So if we could then go to 2 slides from now to a description of the last of the 4 recommendations from your colleagues. This one is very specifically looking at integrating strategic economic development activities into Metro's planning and decision-making. And I feel like the conversation here today has really set the stage for this. It is not that Metro has not been doing anything in the economic development sphere. I really appreciate Councillor Lewis's repeated reminders to us as the team supporting this work to call that out and to remind ourselves and the folks that Metro serves that that's been a part of what we're doing. That said, it's not always explicitly called out, and this recommendation is intended to make that central role of economic development more explicit in our programs and activities. So the way it's written, it really would show up in the resolution in a way that provides affirmative direction to staff and articulates a commitment on the behalf of council members to expand Metro's presence and leadership in economic development forums, organizations, and conversations. And that sounds soft, but I have thought about this a lot over the past year. We are definitely the product of what we hear, where we go, who we talk to, who we learn from, and it is important for us as we make sure we're incorporating the economic development actions and strategies that meet this moment that we are hearing from a broad swath of people, including folks who are very focused on economic development. The moment we're in right now asks us to also clarify that commitment for the public. It's not a changed commitment, but it's a clarified commitment. Really highlighting what our programs have done for economic development, but also what it looks like to incorporate economic development and specifically inclusive economic development more intentionally in our work. So thank you for that. And I guess the last thing I would leave it with before I turn it over to Councilor Simpson for the sort of final wrap-up comments is there is a connection between this and the conversation you all were having about supportive housing services earlier in the day. And we haven't talked about that a lot here. In some ways, there's a very direct connection to human welfare in the way that Councilor Simpson described with job creation. There's also a critically important set of indirect connections, the way our tax structure is set up, and frankly, just the way we fund our services, our infrastructure, and some of our progressive aspirations are very dependent on jobs and good jobs helping support those activities. So this does connect with Metro's work on many levels. So with that, I will turn it back over to Councilor Simpson to make some final remarks.
Thank you, Director Chiarlo. Thank you, Tom. Before I take your questions and comments, I do want to take one moment to thank the staff who worked diligently on this. From Malou Wilkerson, you, Director Chiarlo, you, Tom Reinhardt, Victor Sin, Robin Yee, Jay Cromwell, big shout out to Jay Cromwell, and Andrea Celentano. If I'm missing somebody, you call them out.
I think Hal Hagedorn helped us a lot, and David Tetrick helped us a lot,
yes, that's right.
Too,
Hal and David, for sure. I want to really, my hat comes off to those individuals for pulling this work together behind the scenes while we as counselors did the other parts within the community, so thank you. Thank you all again for your time this morning. I'm open, the rest of the council is open for questions and/or comments or recommendations.
Great, thank you, Councilor Simpson. Let's go with questions. We'll start with Councilor Rosenthal.
Thank you, Deputy Chair. Interesting food for thought. First of all, I think it's about time that Metro has decided to take economic development in less than a cavalier approach, which it did during the previous updates, transportation plan particularly. So I think that's good, and I want to thank the other councilors for being very active and involved in this issue. I'm speaking as somebody who represents one of the largest economic development areas in the district, the whole southern Washington County area, which has land and capabilities, but is not, and is moving with some economic development, but still has a lot more potential. I have a couple questions, well, a couple comments. The first comment is the sooner we can identify the key industries or the key economic sectors that we want to focus on, I think the better. I think, I could come up with a preliminary list because each one of them is going to require slightly different nuanced approaches and maybe fitting into certain different economic sectors. So some of them have a lot of land requirements and some of them have smaller land requirements, mostly technology. I think we also have to consider the entire Willamette Valley, not just the metro region, because as was pointed out, institutions of higher learning, particularly research institutions, are very critical in drawing people into the area. So I think we have to do that. I think we also have to include a more robust transportation analysis. One of the key points of a transportation system is to connect people from where they live to where they work. So I think we have not done that in a very efficient way. The area, in my area, there was really no discussion of that in the previous RTP. So I think there's a lot of work that yet to be done. I think I agree with in general with the recommendations. I think the housing one is sort of interesting to look at because we have the smallest need for the kinds of housing that we say we want with very high quality jobs. That number of identified need is 700, and we have quite a bit of land. We did an inventory and said we have enough land to accommodate those. We just don't always have the infrastructure available or the means to pay for the infrastructure available to allow these areas to develop. And I'm thinking particularly of some large areas that are in the urban reserves in Clackamas County particularly. So I think we have, funding becomes a big issue. Funding for infrastructure, both for pre-development for the industries as well as for making some of these, residential lands available. So as for the, our biggest need, and it's a really very different need, is for affordable housing and for lower cost housing, and in some cases for workforce housing. Those are all require separate approaches. And, we're tackling those we tackle those with the housing bond and with SHS, but that is really a different issue, and that's solving a problem. It's not really an economic development issue in my view. So anyway, I think there's a lot of work to be done. I think this is a good start, and I hope we take it seriously. Oh, one question I had is, have we asked, and I noticed that WEA was not included in the list of partners, but WEA has been the one entity that is, at least as far as I know, maybe there's been others, have we asked all of them to submit recommendations as to what changes Metro should make in its policies or procedures? Because I know WEA has submitted, recommendations, and we've considered those, and, and I'm just wondering if we've asked the same request from all the other partners, whether it's Travel Portland or GPI or whatever.
Would you all like me to answer that question? I'm happy to do so, or?
Yeah, I can tag in on this. So to your first point, around transportation, this is our initial work. This is ongoing work, and we see, at least right now, while we have a lot of uncertainty around transportation funding, I don't think it's wise to try to bake that in, and I get it, transportation undergirds everything that we're talking about here, but this body is intended to continue communicating and working with our JPAC chairs, as well as talking about how we include transportation as funding comes along, funding conversations and phasing happen. When it comes to our recommendations from our partners like WEA, Travel Portland, I really my hat goes off to my colleagues, Councilors Lewis and Gonzalez, for having those conversations and getting those recommendations adopted into this work, as well as, and I'm gonna say myself, getting out there talking to like the Gresham Chamber, Travel Portland, and others to make sure that we are capturing the spirit of what they would like to see in metros moving forward with this. Now, we could throw everything at this process right now, and we could fail, because there's sports tourism to talk about. There's a whole host of other pieces that we can add on to this. We need to get our base under us right now, and that's what this initial process is, so that we can, as we move forward year by year, we can add on layers of the work. But right now, if we decided to throw everything at this one problem without resolving the issues that we can primarily and put our hands on and pull the lever on, I think we are setting ourselves up to fail. Councilor Nolan has a question.
Thanks. I'm interested in the input process as well. You've been working for a year, plus or minus, with stakeholders, which you've reached out some, and I appreciate your educating me about that, but it seems to be mainly business interests. Certainly they have some stake in this, but what kind of public process are we looking at in terms of public input? Because putting emphasis somewhere costs money, costs resources, some balancing there, and we've got this future vision going on, and how do you anticipate, or how have you thought about integrating this process into the future vision process? In some ways, it's tough to know what kind of industry you want to recruit until you know what kind of community you want to be, and we are putting a lot of our reputation and resources and partner connections into the future vision process. So I want to make sure that we've got them sequenced properly and integrated properly.
Councilors, I'm happy to answer, also happy to defer to you all.
Go ahead.
Why don't I address specifically the timing question? Actually, I think I will back up and just say, You are correct that we did not do an exhaustive public outreach process as part of this work.
Haven't yet.
Yet, thank you. It's a new model. We actually spent quite a bit of time as counselors and supporting staff working through what it looks like to have this type of a council work group come up with recommendations, bring them to you all, have you all say, yes, we do want to adopt that as a priority of the council. And I think that is a moment for you all also to weigh in on how much public input needs to happen as a part of that. So I see that in the future, and I think that will be both possibly for the initiative broadly, but absolutely for the individual actions that Metro works on economic development-wise into the future. With respect to the future vision, I think you know we've been before you, and we will come back to you again talking about engagement. There are a number of folks on our Future Vision Commission who have called out very specifically the types of inclusive economic activity they would, or the types of inclusive economic vibrancy they would like to see in the region. We have not and will not get to the level of specific industries in that group. We're about a year out from that recommendation, and as we work.
From which recommendation?
The recommendation from the Future Vision Commission.
Right.
To you all about what the vision looks like. But even that vision will be higher level. In the meantime, we have a lot of input from years of work with the SEDS, looking at opportunities, looking at partner sort of readiness or lack of readiness to move things forward. There was a certain amount of public engagement in that, and we really see these efforts as sort of parallel. That said, I don't expect an enormous commitment of resources beyond the Job Ready Lands program to move forward in a time frame that would be before the future vision. So I think we're going to see quite a bit of overlap. We're already seeing overlap in terms of how the conversations are happening, and I think we'll be able to structure in specific engagement overlap. And there is an opportunity, as you all think about, you know, we'll continue to ask you about engagement with Future Vision. And there's absolutely an opportunity for you all to ask our team, which is working on that project, and others across Metro who are working on that project, to be more intentional about including the types of economic development questions you're asking. You know, I can't tell you right now what that looks like, but it's your project, and so you all have you are warmly invited to encourage that. Yeah.
And if I can add a second answer, I appreciate that the framework of the Future Vision is set up to answer some of the questions that are on the table and will surface through doing this work. The timeline that I've really hewed to in a way that has totally annoyed staff, but I think is really important, is that I'm looking for us to have these conversations and this level of public process in time for our budget. Because our budget twofold, one, will enable us to do some of this work, and two, will help us define which level of investment we want to make in the SEDS. You know, SEDS is a 5-year cycle. We don't get to delay it because we don't know yet. It is coming at us, and we have to decide. And traditionally, well, I say traditionally, but 5 years ago, we were about a 50-50 stakeholder in the SEDS, and I think the expectation is that we're still going to be that kind of like co-lead, but what does it mean on the process side and on the doer side, not just the money side, to be a co-lead of the SEDS, and that has budget implications as well. So to the extent that this is the opportunity for us to like put a little color and flavor on that, it will have trickle down or trickle over effects into our budgeting conversations, which are like gonna happen in 6 weeks or something. So that's the timeliness we're in.
Yeah, the budgets are already, are they sitting on your desk yet?
Yes, I was actually going to give an update on that in the COO
council communication update.
And I appreciate that. And I truly appreciate that we're trying a work group. It's a format that I think can be very helpful for council work, and especially for initiative work. And we're going to stumble a little bit, but it's not a surprise that CEDS is coming up for its 5-year renewal.
That's right.
And we seem way too often to be put in a box where there's a deadline imposed externally, we have to meet, and so the part of this process that suffers is council deliberation and public input, particularly public input around existing policies. We haven't even asked about racial equity aspects and how that established metro policy, which I understand is being updated, but it's still established policy, how that has fed into this. How has our climate policy fed into this? These are established policies that council shouldn't have to remind staff that they should take into account in developing things that come back to us. So I'm
thank you,
looking
Councilor.
for, oops, we should have and we didn't. And here's what we'll at least talk, and we'll report back about how we will make sure we do that before it comes to council for any kind of action.
Thank you. There's always room for more reflection on this. So in no way do I mean to suggest that we're done thinking about this, but I have had a conversation with our DEI director, and our agreement has been that it's once you all have made your recommendations via resolution, that part of that resolution would be directing close coordination with the DEI department to make sure that we are incorporating these pieces as we move forward. We have not made decisions yet, but there will be decisions made, and
You're coming
heard
back
and
and
understood.
asking council to take action, and you're telling me you've sat down with Serena or maybe texted her and said, well, we should coordinate about this. This was a big issue I brought up during the urban growth process, and I frankly would have expected that the planning department would have learned from that they shouldn't be bringing forward recommendations through counselors, through a work group, through any format that haven't been weighed against existing policy.
I think I'm going to let the counselors speak to that.
Yeah, no, thank you. Councilor Nolan, we did work with our internal departments around making sure that our policies reflect. And that's what I mean by when you asked earlier about the industry analysis, I was very clear about saying we're still trying to figure out what that Oregon way is. And part of that is us reflecting back on our climate and racial equity policies, especially now as we have them updated to targeted universalism, which is the whole intent around this work. And I'm going to say this, and I've said it to all of our partners, I'm very bullish about this work because people in District 1 have been left out. The lie has always been we're going to make transportation investments so that we can shuttle people back and forth, city center, wherever, so they can get to work. Well, part of this work, again, is to focus for me on District 1, where a lot of people of color are not a part of the socioeconomic process and have not been and have been asking us to do this work for some time. So,
And I value and honor and admire your advocacy for District 1. What frustrates me is I have to ask questions to hear this kind of thing, that it isn't front and center in the way you're describing this initiative, that it isn't something that you shared with us during the course of the year that you've been working on this, but instead, we kind of know it's happening out there, but we're only really getting to recommendations today. And sometimes I think we have to remind ourselves that when we're in the thick of work, that others are not in the thick of. We assume that they have followed our train of thought when they haven't had any access to the information or the conversations or the analyses. I'm asking for the council, this counselor in particular, but the council as a whole, to have the benefit of that in a way that makes us full partners so that the strength of this program is augmented and it is an agency initiative and not just a 3-counselor idea.
I'll second that.
Okay, well, I want to thank the counselors and the team for putting so much work into it. I think this is a great start. I think for me, I'd like to incorporate our comments and really think about how you want to articulate the narrative and the theory of change behind this work. And I think one place I might start is, we have these existing lenses that Councilor Nolan brought up. For me, like racial equity is way up there. It's our guiding principle. And I want to make sure that the benefits and burdens of this economic development work are equitably distributed, that we're getting the jobs that we want to see in the places they need to be, and our community members are able to, build the lives that they want. And I think that's like what we all want to see, but I need to know that that's part of the theory of change. And then, like, I think, Tom, you're talking about investments in land and in other places that we need to make. I really like that frame because I think we spend a lot of money, but we don't make investments the way that other regions do. But I want to know the return on the investment on those. So I think if there's like an ask of Metro or the state or the, whatever layer of government, I would like to see the scale of investment that we need to see to make us as competitive as possible so that we can tell our constituents that we're going to invest this money and we're going to get these returns. We're going to see these impacts in the communities, in District 1, wherever, of the people that we need to center. And then that if we make these investments, they're going to pay off over time. Like, we're going to invest in this, our tax base will grow so that we can invest in everything else. And I think that's kind of the arc that I want to see, is like, who are we centering, how we get there, what's going to cost, and what do we get back for that investment for our community and for the local governments. And I think it's all there, but like, if you could articulate that a bit more in this resolution, and you like just be able to tell us that story of like, here's the problem, we make these interventions and here's the returns. I think that would just help me a lot. And I see you all are working on that. But yeah, that's kind of what I'd like to see. And I don't know, Tom, if you have like a rough estimate of like input versus output, like what's the scale that we're looking at? Like, if we want to be as competitive as Minneapolis, what will we need?
The scale of investment question is very hard to answer.
Yeah.
I think the short answer that I will give you, which I think has the most integrity, is you couldn't spend enough to get probably where we want to be, right? So there's orders of magnitude of investment needed in a lot of sites. So let's just put that out there. What I tried to lay out for the staff in a couple different memos was there's different ways to think about targeted spots and a range of how much they would cost to move from one designation to the next. The team can work with that. And I think you can get to a first stage, and with working with the COO's team and that budget process, you could probably get to a first stage on that. But I don't want to try to fool anybody around. We know the resources aren't there to solve all these land problems. Even within the UGB, the outside of the UGB is a whole different question, right? That I know you guys talk about a lot, but within the existing urban growth boundary, there's so much needed to get mid-sized sites ready that, I would hazard, a guess would be ridiculous on that. I think it's safe to say you can make a tangible impact and have a range of like ROI to public coffers and jobs based on comps with other regions, and we can find those.
Yeah, I think that'd be,
Does that make
I
sense?
think we're trying to make the case for this work and for these investments. So like, yeah, if we put in this, like, what kind of benefits will we see? I think that's going to be the guiding principle, and just being able to really define like, what do we mean by,
It's very helpful.
by benefits? Thanks.
Would you accept a friendly amendment to that request?
Sure.
For me, it would be useful to know number of jobs. Every job is not the same, as our represented audience members will tell us. It would be really helpful to have a sense of where for the investment that would be required, dollars, however many tens of millions of dollars, hundreds of millions of dollars if you're talking infrastructure. Who benefits? Is it the developer? Is it the business? Is it someone who's shipping all of their profits out of state? Is it folks who are living here and being able to move from a minimum wage job to a represented job that's got benefits? Because I want to invest in that latter one. I'm not too interested in investing in the other. And I doubt any of my colleagues who are on this work group are interested in that. But if you don't measure it, you don't get the results you're expecting, you're seeking.
Great, thank you.
Thanks.
You're welcome. Councilor Gonzalez.
Thanks. Yeah, I mean, real quick, if we could pull back the slide that talked about values, in which we talked about high quality jobs, which I think covers a lot of what we're talking about as North Star and guiding metric for the work. I think it'd be helpful just to remind us about that. I do want to spend a little bit of time kind of trying to reflect on how to move some of this work forward, because and in terms of like council procedures, council office structure, I mean, we've had a lot of retreats thinking about how we want to make policy, how councilors can lead more policy. I'm looking at, I think we have 2 staff from our whole council office here. So, Anne, I'm going to ask you as our highest ranking person right now in the entire council office that's here to support the council, to like help us really figure out next steps for, I think we've been talking about like codifying different roles. So in a work group, like what's the role of the chair? What's the role of the committee members? And something that's really clear to me is that we need to be way more focused on the iterations that bring the council along. So it's not just like we meet for one group for 1 year and then we present to you at the end of the year. So it's like there has to be multiple touch points. So I absolutely hear you on that. And I completely acknowledge that that is not something that really, that is an area for improvement. So I think we need to codify that as a council. So that's why I'm asking Anne to like help us in working with our chief of staff as we're continuing to evaluate what are the new mechanisms for us as a legislative body to lead in collaboration with staff that we can do that. So one, I'm like, I want to land that somewhere so we have a piece of work to go forward. And number 2, I think also there's a lot of work that was surfaced throughout this work group that I think we could have maybe linked on a slide. So I'm just thinking through like policy that we've attached, major policy items that have been recommended to us as a result of this that might help clarify that theory of change and logic model a little bit more. You know, we have our strategic targets. I see Melissa has the slide up about a resilient economy for all, which was one of the things that one of our major policy initiatives that over the last 18 months that we adopted. That could have probably been a slide that we addressed here, right? So kind of, I think that there's no shortage of policy kind of umbrellas that the council has. And like one of the anecdotes that Councilor Simpson and that I know I've received is, for example, IBW. They've been talking about how their apprenticeship program is almost completely frozen out to 0 new registrants because the work is not there, because the jobs are not there, because the jobs that they need to work on, you know, Metro has a role in creating those. Those historically has been a lot of work at semiconductor and fabs, you know, some data centers here and there as well. So when a lot of these kind of core clusters start to slow down, it has significant downstream effects. And so I think to your point about engaging building trades, about engaging folks that really think about these high level jobs. I know a lot of our building trades partners, our union partners are thinking about, you know, where's the work going to be for our members in the future. And so I see this work as trying to address that, because Metro, as we were talking about, there's a lot of different partners, a lot of different people that play in this. We have a pretty like narrow role, but a really critical role that a lot of people see that we haven't really leaned into it as much as we probably should have. So again, I think those are kind of some important elements that I wanted to reflect. I think really valid conversation. So council policy, council procedure, I think is really important for us to continue to refine on. And I think like these little mistakes are okay, but I want to make sure that we really feel like we have those next steps to move forward. So anyway, just some reflections for me in terms of, I think, how we go next steps. And so Deputy President, I'm not sure if like, so the question to the council, do we feel like we need to do this presentation again? Maybe kind of connecting some of these higher level elements? Or is it like a lesson learned for the future, for future work groups? Because I do want to make sure that some of these questions around racial equity, racial justice, climate equity, climate justice are really, we weave those in because there's a definite connection there. And I don't want this like incredible amount of work that we've done to kind of lose steam and lose momentum because those dots were not connected. So I'm more than willing to make the time, take the step back a little bit, kind of reorganize the slides a little bit, tell a different story, bring more partners to the table in a different way. So anyway, as a committee member, I wanted to offer my reflections there because I think this is like existential to the future of the region.
Okay. Councilor Gonzalez.
In the next 2 weeks?
What's that?
It's existential to the survival of the region in the next 2 weeks?
In the next 2 weeks, I mean, I think.
What difference does it make if it's approved in 2 weeks or in 2 months?
Are we talking about the internal procedures? Because I think, this council, I think in our last meeting identified, we need to have further conversation about how we work with staff and the time allocation.
Right.
And I think we also need to improve or document processes around councilor, like committee work groups such as this. And I think that those both are not related to this topic area, but to how we run and govern internally. So I think we should maybe separate those and have a conversation around procedure. But I think the content of this topic, I am ready, if we can incorporate this feedback, to have another conversation in 2 weeks for resolution and continue to make sure that, all the concerns from councilors are continued to be considered and put into, this plan of action.
Yeah.
How does that sound?
Sounds good to me. I think.
It sounds to me like we're officially adopting a policy of ask forgiveness after the fact rather than permission ahead. If that's what we want to do, that's fine.
Well, I think that's.
Councilor Nolan?
Repeatedly say, oh, we should have done that. You're right, we should have done that, but we can't because there's a deadline. And I don't know what the deadline is for this policy. If we're missing an opportunity, the SEDS, you mentioned the SEDS, but.
So a few things for me as a commissioner, and I love this conversation. I think we've been trying to foster this environment where we actually talk to each other in the public. I think this is fantastic, and this will hopefully help us make the best policy for the region. One, I feel like I've heard this council say over and over again, we can't let perfect be the enemy of the good in helping us to advance policies that align with the region. So one, I want to say that. Two, you asked, like, is this existential or not? I mean, I can't speak for the entire council. I mean, to me, it is, after spending the amount of time engaging with partners, the work that the governor is doing, the work that I see the legislature mobilizing behind. In my opinion, I don't feel like Metro can afford to continue to spin the wheels on this responsibility, and that's important to me. And three, I mean, I do want to also acknowledge, I completely agree that those procedure things need to be separated, but we do need to have organized time around how we talk about them. So I just wanted to completely validate that.
Thanks.
What I hear from that is that standing up this recommendation, which we've seen a dozen slides on, and that's it. We have paper, but we haven't really seen the depths of it. haven't had the kind of briefing on most policies that come here for resolutions, but running that through the sieve of our racial equity policy and our climate smart policy is spinning our wheels. And I don't think it is spinning our wheels. I think it's substantive work. And I wish I didn't have to be the one to bring it up. I'm actually stunned that we don't do that on a routine now.
May I?
Please.
I want to honor what you're saying, Councilor Nolan, but I also want to point out that, and the reason that I pulled up the slide from the strategic targets is the council designated these strategic targets through a process that included a guiding principle of racial equity. At this point in maturation for Metro and racial equity, it's not a separate silo.
Right.
Racial equity and those values are baked in as guiding principles in most of the things that we do, if not all, at the beginning. So you have that guiding principle, you have council-approved strategic targets, one being a resilient economy for all, and I just want to read the strategies here. So this is having a strategic target, having these strategies guided by racial equity is racial equity policy. So I don't want to lose track of the fact that this is all this work has been touched by those values. Could it benefit from an additional application of an equity lens as we look at these specific pieces and decide what our targets are going to be? Yes, racial equity work is ongoing, it's iterative, it's important. But I do want to protest a little bit that at the insinuation that racial equity was not applied in this work. Strategy 1, attract, retain, and support business growth, small business development, movement of goods, vendor diversity, COVID. I'm hearing all of that in this presentation. Development-ready communities, increased land readiness, number of shovel-ready sites, process improvement, timelines, available resources. And then strategy 3, workforce training and development. So what I'm seeing here is, a presentation that addresses some of these strategies that are council adopted within the value and guiding principle of racial equity. There is always more work to do. There's drilling down. If we adopt targeted universalism, we will have, data. What does it mean, a resilient economy for all? Where are people in our community situated? What additional strategies or tactics do we need to move those people from where they are to that feeling of, being a resilient participant in our economy? The work continues, but I think that the values, the guiding principles of the council from the strategic targets on racial equity are clear, shining through in the work here. I would argue.
Councilor Lewis.
Thanks so much, Deputy President. I just want to really head-on address that we have an urgent moment to meet, because even if we were to adopt this in 2 weeks, because public contracting is what it is, we still don't actually have a contractor on to do this work until the end of this year. That is meaning we are so far behind where we need to be in order to be ready for the 27 legislative session, if we're even going to be ready for it. So I'm already anxious, to Councilor Wong's point, of being able to put together the list of investments that are needed just to scrape the surface, the top tier, the easy ones, the cream of the crop. And no, there won't be enough money for those investments, but choices will have to be made based on some level of analysis that if we adopt this in 2 weeks, we'll barely meet the deadline for. So I'm anxious to move forward with this and have a separate conversation about how we work together in work groups. We've never had a council or work group before in at least the past 8 years. It was clunky. Every councilor was offered at least 2 briefings. I sat in on some of them. We'll deal with the lawyers later on what that meant for public meetings, blah, blah, blah. Very serious. I am anxious to figure out how we have real conversations, because here we are doing it, but we're also 13 minutes over the hour we were supposed to be done, and we haven't even gotten to councilor communication, which is our normal tool for having these conversations. But every single time we get to councilor communication, Somebody's already late for a meeting, we all want lunch. It's always at the end of the agenda, it's never at the front, and it's always a rush. So I don't know how we schedule ourselves a good 30 minutes, 40 minutes just to talk to each other sometimes. We gotta figure it out.
You do? I'm with you on that.
Put it at the front of the agenda and let whatever's on the
Well-
agenda get squished at the end.
It does sound like we're going to have more conversation about internal operating procedures to share information. I think we'll talk about that in council agenda setting and create some workspace time for that, because I think that's coming up in so many of the projects and initiatives that council has. So I hear you all, and we will set a time to talk about it in the very near future. But I do want to move on this topic. I see Councilor Rosenthal. Do you have a closing comment?
I'll just make a quick comment. I'm very glad we've had this discussion. I think your point, Councilor Lewis, is correct. We haven't had a lot of these discussions, and we probably should have more. Economic development is a complex issue, and I'm glad we've brought it out of the conference rooms and into a larger discussion. I think we will have more. I think we have to think big in terms of, because we have a regional representation, but I think to quote Clint Eastwood, I think we have to know our limits, and we're going to have those. But probably the biggest thing that I'm worried about coming forward is the financial aspect, and the fact that when we talk about economic development, we're also going to run into tax code. And, do we do traded sectors, single factor sales? And this affects how much money the state has to do some of the initiatives, or that we have to do some of the initiatives that we want to do. So it's going to get dicey in '27.
Thank you. Okay, well, I want to thank you all, and thanks to the counselors for this hard work. I was able to attend a number of those briefings, which really I felt caught me up. I understood there was a process happening with council leadership, and just leaning in and spending time with you all and the staff really helped me understand where we're headed. But I'd like to systematize that a bit more and have opportunities for everyone to feel included in the process. And I want to appreciate everyone that came and worked on this. I'd ask for your forgiveness for us muddling through some uncertainties with ethics rules around how we communicate with each other, and a new process doesn't excuse it, but it's something that we'll learn from and grow from. And that shouldn't get in the way of this really important work that our region desperately needs. So thank you for your work.
Sweet.
Okay.
Thank you.
We're going to move on to COO communications.
I will defer my updates until next week.
Okay.
Thursday.
And councilor communications.
Yeah, I'll just, because of the economic development in the district, Victor and Marielle had a meeting, and I was not available with the city of Wilsonville, and there's been a lot of discussion about more coordination that Metro can do about economic development in that area, and both Tualatin and the city of Wilsonville. Tualatin is implemented, and Wilsonville is in the process of implementing TIF's, a tax increment financing, to finance certain kinds of economic development. So that's going forward in that area.
Thank you. Councilor Nolan.
Thanks. Just wanted the council to know that the Regional Waste Advisory Committee met last week, is continuing its work on developing advice to the council on the system facilities plan, with a focus this next few months on the transfer station part of it, the Metro owned and operated transfer stations, as well as the privately owned transfer stations. So you'll be getting a recommendation from the RWAC probably in April this year, given our schedule. And simultaneously, the council will receive a recommendation from RWAC about rate setting for the new fiscal year, probably in May. Work's proceeding.
Great.
Good conversations.
Thank you. And just real quick for me, I spent the weekend at the convention center at the Star City Games convention, played a lot of games. It was great, and its staff did an amazing job hosting the 1,000+ people that came to the convention center. So appreciations. Okay, our next regular meeting is scheduled for January 29th at 10:30, and the council meeting is adjourned. Thank you all.